Sorry about the delay. It's hard to get into this building without being spoken to. Okay. So we're doing subcommittees. First up is HB 1406, prohibiting health carriers from using artificial intelligence to change the clinical judgment of a provider. So is Representative Gregg here? I think she has an amendment, or somebody had you.
I'm speaking for Representative Gregg because she just got out of the hospital.
Yeah. Okay. So do you have that? You have this so-called amendment that she has?
Yeah,
986H.
Okay. Okay, so I don't, obviously we don't need testimony. You could have, go stay in your seat.
Oh, thank you.
Stay. Okay, so Michelle.
Good morning, everyone. Michelle Heaton from the New Hampshire Insurance Department. Excuse me. So the department worked with Representative Gray to try to address some of the issues that she had highlighted in her initial bill. So her concerns related to the use of AI and a concern that AI was being used to override claim submissions by healthcare providers. So we spent some time working with Representative Gregg and showed her a lot of the stuff we had been doing in this space. We have our AI bulletin, and we're adopting some of the AI principles into some rulemaking that is currently underway right now. However, she really sorry, give me a sec.
What do you got in there?
Sorry, I'm getting over an illness. So she wanted to make sure we codified some of that stuff into our statute. So we worked with her to really build off of some of the principles we had already started forwarding in SB 561 relating to prior auth previously. This just builds on that stuff and puts in some additional, it makes more explicit some of the record keeping requirements with respect to artificial intelligence. It clarifies that adverse determinations include any reductions in payment or down coding. It also includes some of the record keeping requirements, builds off of that, and really codifies a lot of what we're putting into our rules already. It also requires that when a health carrier outsources any kind of AI use or uses a third-party entity's AI, it has the responsibility to oversee that AI as well and make sure that it's complying with all laws and regulations. So it's a very, it really is just building off of those same principles. It makes some minor additions to RSA 420J6, which is our utilization review statute. But it's in line with all of the other work we've been doing in this place. And that was, I think, our initial concern was that we didn't want something to be codified that could possibly conflict with what we're already doing in rulemaking. And we are very confident that this is going to address all of Representative Gregg's concerns. So I'm happy to answer any questions.
You have a question in your response? Yes, of course. You.
I just want to say something because after all, I had to spend all night on this. The bulletin that we're talking about is about
Yes.
20 pages or thereabouts, 9
Which we
pages,
saw.
something like
Which
that.
we all saw, yes.
As an NAIC bulletin, and it's almost word for word because I did the comparison, and it's good, but it's
Did you
general.
use AI to do the comparison?
No, I use these eyes. It's good, what we did, but it is not particularized for healthcare. And I think the few things that this amendment puts in is to particularize that bulletin specifically for healthcare. And there's a few little things about keeping records and all that sort of stuff. So I think it's really a good idea because it wasn't particularized for healthcare, and that's where all the problems seem to be that people are getting all crazy about, with various lawsuits that are coming up. And I want to point out one other thing. Last week or 2 weeks ago, when I presented the study bill that I wanted to put up, the most prevalent thing that the reinsurance companies are looking as a risk, of course, is weather. But the second is AI not performing up to the requirements that are put upon it, that it's not fulfilling the needs because with mistakes. And they expect so many lawsuits from this, it's going to be crazy. And the lawsuits have started. So the idea that we get our hands around a little bit of guidelines, I think, is a good one. And that's what I have to say.
Well, I mean, if I understand this correctly, basically, we have a bulletin already. So technically, and as we all know, bulletins have the force of law. They're rules.
Well,
It's a rule.
They don't necessarily have the force of law, but this bulletin outlined how we would regulate AI under our existing regulations. So
Okay.
we do believe we have the ability to enforce everything in that bulletin. This is an area that is evolving. We are working very closely with the work groups at the NEIC to make sure that we're on top of all of these issues as they evolve, and we're working with our fellow regulators so that there's consistency among the states and how we go about regulating it, how we're defining these terms. And so we want to definitely preserve our ability to evolve with the NEIC. And so we don't want to put anything in our statute that would be too confining. And we believe this really strikes the right balance.
Okay, yeah, well, we don't want to be out different because then insurance companies don't want to do business in the state. So, my little concern has been, and is that we don't want to get out in front of this AI and saying that, you know, we're making judgments about it already because it is like this foreign species that is, you know, growing with knotweed. But just a second, let me finish.
Okay.
So the key element is that what I hear is that this is no different than what is now in, for all intents and purposes, what the department feels the policy and regulations. So we're putting it in the statute so that people can see it in the statute, because rulemaking sometimes is a little out there, and certainly bulletins are not really readily available for average people to know. So in this case, we're making it so everybody can see exactly where we are, where the state of the art of AI is for New Hampshire, and you're comfortable with this.
Yes, there's nothing that prohibits the use of AI. What we are regulating is that if AI is being used, it's being properly managed.
Right.
There's documentation about what's going on. And it's not necessarily a change, but just making more explicit that any final adverse determinations need to be made by humans. That was already required under
And
the
I
statutes,
see that
required
in
under the
there.
rules. And this is just further clarifying that, you know, there needs to be documentation when that adverse determination letter goes out that has, you know, the clinical rationale while something is not being approved. And that's really already required. But I think, you know, there's a lot of concerns about AI and how it's being used. And so this just makes it more explicit what is required and when you're using AI.
Break.
This is a subcommittee. We're a little
We're
more
allowed to
relaxed.
talk.
We're a little relaxed, yeah.
You made a comment that you didn't want to be out in front of this because it is an evolving thing. There's 8 states that have put some pretty hefty laws, both Democrat and Republican states that have put pretty hefty laws against, around AI for medical. So we're not ahead of anything. And that they're pretty adamant about some of the situations that they've seen in the various states. I can give you the names of the states if you care.
In terms of what other states, and I've been around as long as I have, there are a lot of states that go out and they pass stuff that is just unenforceable. But they all feel really good about passing it. Okay, and I'm not into feel good. I mean, I don't know what you feel, but I feel good, you know what I mean? And the other one is, as the famous words by Neil Kirk, was prophylactic legislation. we're going to close the barn door before the horse gets out. Well, this, we don't want to say we're, immediately going too far without really knowing whether there's really a problem or not. So, in this way, okay. Representative Burrows.
Thanks. I have a question, which is, do you think that this should be a legislative fix, or is this something that healthcare systems should be putting in place to regulate themselves?
What this amendment is doing is making sure they're doing that to self-regulate. It's not preventing AI. It's saying if you're going to use AI, you need to be monitoring it, you need to be documenting this stuff, and you need to be doing it right. And that's kind of the principles behind our AI bulletin. It's a framework for if you're going to be using AI, this is what we expect you to be doing to make sure that you're using it appropriately.
Thank you.
You. Can you please remind me if there is an issue or problem, or you find a health carrier is not following the guidelines, what is the remedy or enforcement? Thank you.
Thanks. That was another issue that Representative Gregg wanted to put in here, but where this amendment lies is in 420J. So in 420J, any violation of our laws, we have the ability of the department to do an investigation or an examination to make sure that you're complying with the law. And if we find that you're not, then we can take an administrative action against the carrier. So that could be fining, or it could be up to revoking their license, depending on the situation.
And how would you find these situations? Would someone need to call? Do you do proactive monitoring? I'm just curious, since this is such a relatively new area.
It's a mixture of both. We do a lot of monitoring with respect to prior authorization, utilization review. So that would be kind of our first line of defense if we found things that didn't look right happening. That could prompt us to go in and request this documentation that they're going to be required to have and review it. We could also do an examination where we go into their systems and see how they're working. And through all of that, we would be able to determine, whether they're complying with the law or not.
Would consumers understand that this is just such a new area? So how would consumers understand that their final review needs to be done by someone, not something? So how would consumers understand what their rights are?
So when they get an adverse determination, part of the requirements for our utilization review is that the carriers send out a letter to the covered person, and it needs to be in plain English, that's understandable, explaining why whatever they're seeking is being denied and the reasoning for it. And so in those letters, the covered person should have a very good understanding about why the carrier is denying coverage for whatever it is that they're seeking coverage for. In that letter, there's also required disclosures telling them about their appeal rights and their right to external review. And there's also a requirement that they put a little notice saying that the insurance department is there to help them as well. So consumers can always reach out to us, and we're all more than happy to walk through what happened, explain it to the consumer, help them get to the right place, and then also help them with their appeal rights.
And that happens currently. Yeah. Is there anything that would be needed to add to that disclosure, in your opinion?
No, I think all of that is fairly sufficient. I think where we can make improvements is just making sure that consumers are aware of their rights and that they are actually reading this and they have a better understanding of how their insurance plan works.
So if you look at, it's a very good question, just it's important to look at the pieces here, in which both Section 1 and Section 2 are monitored by the insurance department. Okay, so that when they get audited, on how often you audit them?
For market conduct issues, it's on an as-needed basis. So when we see indications that there's an issue.
Right, and so therefore, then they come in and they're gonna ask and say, okay, let's see your letter. Let's see your letters. Let's see, there are things they're supposed to maintain records of, okay, and making sure that they're actually in both 1 and 2, Section 1 and 2, both highlight that. Representative Teresa.
So I have a quick question. The current setup that we have where, yeah, consumer do have right to appeal and, the decision, etc. But there is a big time window by, after which the insurance department the insurance carrier, they can respond. And by the time probably, the time is very critical in these cases. So in case of AI, since we are including AI, and there could be instances where things could be wrongly denied, do you have a timeline set, like by that time, the insurance carrier should be responding?
Yeah, our statute already has timelines for prior authorization. That was part of SB 561. It put into place that if you're submitting a prior authorization electronically, it has to be addressed within 14 days. If it's non-electronic, it's 30 days. And then if there's an appeal, the carrier has to act on those appeals within 30 days. So those timelines are already there. We also have sorry, my mind just, if it's an expedited review, so if it's something, that you need urgent care for, there's a 72-hour window that the carrier has to act. And if they don't act within that window, then the prior auth is deemed approved. So there are a lot of protections in place to make sure this is happening on a timely basis. And that's part of what we do when we are going in for an examination or investigation, is ensuring that the carrier is consistently making those deadlines.
Okay. Yes, Representative Burrows.
Okay, this is just a would you believe. I'm reading here that there's been a 14% rise in AI-related malpractice claims between 22 and 24. So I'm sure they're going up. And there's also class action suits that are targeting insurers. So, that's, and they're using that some of these insurance companies are using the algorithm to deny hundreds of claims. So just an interesting fact.
Yeah, and on that point, a lot of those suits, I have yet to see one that's for the commercial markets that we regulate. A lot of those suits are for Medicare Advantage, federal plans, or self-funded plans where the insurer is acting as a TPA. So there are different laws and rules that apply to those plans. Under our commercial insurance plans, we have those appeal and external review rights. So we're not, because you have those due process rights already, we're not seeing those same issues in our markets, but it's definitely something we're monitoring.
Right. This is really, I think, very important point, which is, as we know, we're only limited to regulating individuals and small employers, and under our statutes, that all these other different entities, RISA plans, or the Medicare, we know that those are separate, and we're not regulating those. We can bemoan whether Medicare Advantage is really a disadvantage or not, but we have nothing control over that. We have nothing to do with that. That is federally regulated. But that, we do have our statutes for our small business and individuals. And yes, that's what the department is regulating, which in reality is what's barely 12% of the market, I think is what.
20%.
20%, yeah.
Yeah.
Like your husband? Okay. Yeah, you're right.
Thank you for taking my question. My question is, when any insurance carrier basically denies the claim based on the AI could be wrong also. So are they specifying it in bold somewhere that this denial is based on the AI information?
They would not be allowed to do a denial based on AI. A person would have to make that final determination.
That's in here.
So that's what the key, and that's currently what is required, but it's not explicit. It says who can make the decision. Now we're putting in those explicit things saying that, any final decision needs to be made by a person.
Thank you.
In my position right from the get-go. So, thank you very much. I guess I dare ask whether insurance companies have any comment on this legislation. Right. You haven't seen the amendment? Oh, well, how did that happen? Okay, is there anybody else who like to weigh in on this bill? Well, they do their speed reading. Not that we probably really care what you guys think, right? Since-
Chairman,
Yes,
I just want to make a comment that if we see more, occurrence of denials because of AI, maybe we might have to adjust the timeline that is currently in statute to 14 days and 30 days. Because if there are more occurrences like that, then there could, like you heard, there could be more lawsuits.
well, see, we have no problems at all.
Yeah, I mean,
Okay,
saying.
so if we
in
were to
future,
see some, yes.
we probably have to
I
consider
would say
that.
that we have another bill that could actually be used to step in and address it.
Thank you.
Sure. Dare you.
I'm Director of Government Relations for Anthem.
And I'm Lindsay Nato from Orin Reno, here for Cigna.
We just want to reiterate that we are currently not denying claims using AI.
Right.
I think that seems to be sort of a misunderstanding. So
there-
just wanted to clarify that. That is what the bulletin says. That is the guidance. And so the current state is we are not making denials using AI. There are humans on the other side of those decisions.
At the end of the day, that's the most important thing to me, that when someone gets a denial, there's a name on there and that person can, can take that to the insurance department and say, this is the person, the employee who did it.
So thank you. And even though we haven't been able to read this carefully, I did talk to Rep. Spear beforehand, and we know the insurance department does great work on amendments, so it'll probably be okay. with-
I think to the extent that this is codifying what's already in practice, assuming that the language actually does that, I would say we should be comfortable with it because we're already in compliance with it.
Perfect. Okay,
Thank
any
you.
questions from the committee members? Seeing none, thank you. Okay. Are we all good? All right, so we have a subcommittee. We reviewed the amendment, and Representative Spear, seconded by Representative Petusek, moves off to pass on amendment number 986H. If you really want to write out 2026-0986H. But I cut to the chase and not bother. Representative Spear. Second by Representative Petusek. All right. This is the insurance subcommittee, so we have Purcelli, Burrows, Butler's not here, Miles, Teresa, Hunt, Spear, and Thaxton's not here, so they cross each other out. Okay, well, no, we like you say, we have pairing, so we're all set. Is everybody ready for the question? So the rest, this is ought to pass on the amendment. Okay, all those in that subcommittee, please raise your hand. 1, 2, 3, 4, 5, 6. Zip. Okay. All those, so now the motion is Spear, second motion. Spear. Petusek. To pass as amended. Any discussion on the motion? Seeing none, all those in favor, raise your hand. 1, 2, 3, 4, 5, 6. Zip. Okay. All right. Let me make sure I update my cheat sheet. Okay, next is 1854, requiring insurance carriers to provide peer-to-peer review at any stage of prior authorization and mandating disclosure of your credentials. So do you have an amendment, Representative Miles, or?
Yeah. So I just want to make sure that everyone understands this is the most simple legislation we've seen to date. All this does is require the insurance carrier provide peer-to-peer, which is your doctor speaking on your behalf throughout the initial appeal process. Right now, in New Hampshire, you can only have your doctor speak directly to the insurance doctor before an appeal has been requested. Once you ask for an appeal, that opportunity for your doctor to speak on your behalf, the window closes. That's it. So HB 1554 fixes this gap in healthcare. And if you want your doctor to speak for you to the insurance plan on your behalf with the hard-earned money that you paid for this plan, then this is what we need to move forward. There are no additional costs to any taxpayers. There's no mandate. There's no increased regulation. Insurance companies can still deny the treatment or the medication ultimately. That's up to them. But at least your doctor can speak for you on your behalf. And believe me, they are your best advocate. So I would like to ask the committee to support an OTP with amendment. The amendment is 0508H, which has been handed out to everyone, and it is a simple and/or fix for the last section of the bill, where let's see, it's line 6 through 15. It talks about the reviewer, the physician reviewer's credentials. So this allows them to be either practicing or specialized or have experience in the field, as opposed to requiring them to be practicing and have experience and the other things all at once. There's opportunity there. So there's no additional resources from the plan. It doesn't require any additional physicians. And again, it's very simple.
Yeah.
There's no mandate, no regulation, and simple fix for patient care, patient access. Thank you.
Okay, so, okay, do you have your hand up? Yeah, okay, go ahead.
Just a
Rose.
quick question. How do you determine, what are the criteria for practicing in a similar field? How do we determine that?
Well, to reduce it to its most absurd level would be like, you don't want your spinal neurosurgeon to be speaking with a podiatrist. Something. I mean, that's kind of the most absurd example that I can think of. But if it's a spine doctor who does neurosurgery and an orthopedic that does spine surgery, then that would be considered of equivalent experience.
Question?
Can you think of any examples where it might be kind of up in the air, whether they're similar?
Well, I would certainly hope that if there was someone who needed a coronary artery bypass graft or a heart transplant, that they wouldn't be speaking to a primary care generalist. Mhm.
Okay, Michelle?
Yeah,
The
sure.
amendment is extraneous.
It's not extraneous. It clears up the pieces of what the credentialing doctor has to be doing.
So which doctor is this?
This is the doctor at the plan. So the original bill said they have to be practicing in their specialty and they have to have a license in a specific area. This says or. So
It's less restrictive.
it allows prevents the plan from having to find bigger network of physicians. And that was
So
actually.
that could be a cost to the plan, right? To
No,
have-
this
have
is-
more physicians?
No, the amendment says or, so they don't need more physicians.
Got it.
And I got that language from New Hampshire hospital insurance plans. It was their recommendation.
So, I'm trying to follow the bouncing ball here. So once there's an adverse decision, the concern is that people will immediately go right to requesting the review, using the external review. So when is there a reason, what is the reason for the timing saying is, once you're going to external review, why wouldn't there still be negotiation between the insurance company and the physician, the patient / physician to negotiate something at that time? Why is it that there's a shutdown from negotiating and then going right to waiting within the 30 days to then go to that external review?
So one of the concerns we had that was raised previously was that carriers are just denying requests, and then when peer-to-peer review is requested, that they're able to explain, and then it gets approved. So when we were drafting SB 561, we opened up peer review so that you didn't have to wait till that adverse determination. At any point in time, if you're submitting a prior auth request or concurrent review or whatever it is, you can request that peer-to-peer right up front, so you can have that discussion with the reviewer and really talk about sometimes the complexities of the case that, people felt that they needed. The way it is now, you can request it prior to the adverse determination or after the adverse determination. The initial reviewer is one person. Once there's that adverse determination and there's an appeal, it has to go to someone who was not involved in the initial review. So it's a new reviewer.
Right.
Currently under that process, there isn't really a mechanism for peer-to-peer, and I think that's what this bill is trying to address. And then after that, you would go to external review. I think if you wanted peer-to-peer as part of external review, you would have to amend a separate statute because that is a whole nother process. But I guess this would open it up. So during that appeal process, you could maybe again request that peer-to-peer review. So you can explain it. But in theory, I mean, if they're looking at the records, all of the information should be in the records and in the submission.
May I give an example?
Well, if
It's
the
quick.
example that
It's
you've
really
already
quick.
given, you've
No, it's
given to the
not. I
committee for the
haven't.
hearing.
No, I haven't.
A new example.
Yep.
Okay.
So you go to see your orthopedic doctor. You have back pain. You've already done all the things, rest, ice, ibuprofen, whatever. He says, let me order you an MRI. Puts it in the computer while you're in the room. Okay, you get dressed, you go out to the front desk. The secretary says, doctor put in the MRI, but it already got denied. That fast. That is reality, and that's what happens. So then that front desk person says, oh, do you want to appeal that? Well, of course they want to appeal it because they want their MRI. That is how fast it moves. And that's why your doctor needs the opportunity to talk to the doctor at the plan for the duration of the first process, not just in that small window, because you're walking from the doctor's office to the front desk, and that window of
So
opportunity
what is
evaporated.
when you say duration, okay, you just said the duration of the denial was 10 minutes. All right, the computer, well, obviously,
Right.
computer can't make that decision in the previous bill.
They're
They-
automated.
but they can't because they'll then need somebody, a human being back there
Mhm.
who has to sign off on that.
Eventually, yes.
Not eventually.
Not in real time.
They cannot make that, they cannot make that denial without a human being signing off of it and sending that denial
That is the speed
with
at
that
which
human being.
that's the speed at which we work and live in these days.
But we just changed that with our statute, with our law. Theoretically, if there really was a human being just sitting there waiting for that filing come in, and then immediately turns around and denies it without, I mean, I don't know how they can do it in 10 minutes, but that's your argument. They're making it in 10 minutes. So then they're denying it, okay? And that the person says, he said, do you want an appeal? Do you want our physician to reach out to this person who signed it to find out why or get more detail? Okay, but no, they just automatically just said, bam, we're going to go right to appeal. So my question is that once you go to that appeal immediately, at that point, then whether it's peer to peer or whatever, there's no opportunity for the physician to then call whoever that person's name is on that sign slip and say, that yes, we've assigned, requested an appeal, but can I talk to somebody?
Not until they
So,
go to the next
can
level.
I ask her?
Yes.
Because I think you've said this multiple times.
Hmm.
So
So-
they cannot then go back to the whoever signed the letter, and the letter says, no, I can't talk to you anymore because you filed an appeal.
I think in practice that actually does happen, that they do still talk to them. But I don't know that statutorily it's it would be required that they do that. But I think in practice that is how it works. And just to clarify, if you're saying that this is denied, you would have to issue a letter saying this is denied and include the clinical rationale. So it should never be, it's just denied and we're not really sure why. But even at that point, once the denial's out, if there's the clinical rationale, you can still request that peer-to-peer, and that's separate than the appeal. So it's almost like an extra level of appeal. You can request the peer-to-peer, and then if you don't like that, you can still request the appeal. There's nothing that prevents you from doing the peer-to-peer. I think under the current statute, there is no right to request a peer-to-peer necessarily once you are well into the appeal process, though. So, or you've gotten the appeal determination, now you want to request a peer-to-peer. But in practice, if the carrier allows that, there's nothing prohibiting them from doing that. And so I would have to defer to the carriers to see how in practice this actually works. But I have seen occasions where something is appealed and they still allow the peer-to-peer.
That would be an exception, right?
No, it'd be up to the carrier to figure out what they want to do. It's not a statutorily
Yeah.
required protection.
So you have evidence that the insurance companies shut it down and say, no, we will not have you talk to somebody.
I have evidence that the doctor can no longer speak for a peer-to-peer on your behalf once the denial has been posted with whether it's a letter, a pop-up.
It can't be a
Anything.
pop-up. Right now, we
I
what
know.
our understanding is the current law is already that they get a letter.
A
and
denial
in that-
notification, yes.
In that notification,
Mhm.
but I assume it's a letter.
And then once,
Is it by email or you say
And like-
email?
and like Michelle just mentioned, once you're into the appeal process, you don't typically have any other opportunity
but-
for a
okay.
doctor to doctor.
So what I want to understand is what you mean by appeal process, okay? The process of saying is, okay, so we have set an appeal date hearing, or
No.
how does appeal process work?
They would just file an appeal.
Right.
So they would have to file something with the carrier saying, we're appealing this determination because of X, Y, and Z, and
Right.
then include with it all the clinical documentation to
All
support
all
their
their-
thing. And then someone different than the initial reviewer has to review that again.
Within 30 days.
Yes. And then issue a final determination. And then
Right.
after that point, you would be able to go to external review.
So the intent of this bill is to say that the insurance company, after someone's filed that appeal, they've done that paperwork, done all that language of an appeal, they've already sent this in and all mailed it in, now they're just waiting to hear back? And they don't know how long it's going to be, other than they know it has to be either within 72 hours if it was urgent, or 30 days if it wasn't urgent.
Mhm.
And they have no idea. So what this bill is saying is that the doctor just out of the blue could call the insurance, whoever the physician, it has to notify, I guess. Is there a notification process? That you have to notify that I need to talk to a peer-to-peer?
None of that changes. Yes, that process would be the same.
That peer-to-peer request form already exists?
Yeah, there's a request process and then they try to schedule a time where both providers are available. And usually that is difficult to do. That's the hardest part of the process is
To
trying
get them,
them on the phone together at the same time and
Right.
scheduling that. But
so, but this bill doesn't address that problem. And it doesn't address any time problem. It just, the thing that scares me is this thing is the right to regardless of whether an appeal has been requested. Okay, means that they could keep sending.
There's only
So-
one opportunity.
there's already a requirement in the statute that once you request the peer-to-peer, it has to be scheduled within 2 days.
Oh, okay.
So you have to schedule it, and then within 7 business days, they have to issue something if they hadn't done it already. Like if it's a reconsideration, then it's 7 days. If it's just the initial determination, then they have whatever the 14 or 30 days.
Just,
I think what this bill is trying to do is just saying that whether you filed the appeal or not, you still have the ability to request a peer-to-peer.
Can I make a comment? So I agree in the beginning you said that usually the decision that comes from some person. That is correct. But I also heard in some testimonies before on similar bills where the doctor was saying that usually at the insurance carrier side, their clerical staff, they have a set of criteria by which they can accept or deny the pre-authorization claims. And yeah, that person will sign, but that person is not a medical professional person. He's just a clerical staff. And what I heard also is that
wait,
may-
no,
may-
who's not a, who's
the
just?
person who denies or accept the pre-auth at the insurance carrier side, he is a clerical staff. He has set up documents, criteria. Based on that, he checks the box. Yeah, it's correct. Okay, now approve the pre-auth. Doesn't fall into these criteria, deny the. That's how it works. So what I had heard before, let me finish this part. What I heard before is that, and this is a doctor was testifying that usually maybe 80% of the time that process works, but a lot of times the treatment criteria or the plan are subjective. So when a doctor talks to another doctor at the carrier side, they have better chance to get approved on the pre-auth. That is what he has said. So with this bill, I believe that if there is a provision for a doctor to talk to another doctor in similar specialty, then the whole thing that we're talking about gets denied, then the appeal, it takes time, 30 days, 40 days, and sometimes time is of essence in medical treatment. This will just ease the process. That's what I get from this bill as essence and the objective of this bill. So the logistics, we can work it out, but I believe this is currently this is how it works at the insurance carrier side, and this is a problem.
I can speak a little bit to the reference to 561. So that's exactly what this bill is fixing. There's missing clinical portion to 561. 561 took a big step forward. But if the peer-to-peer review is requested after a prior auth denial, the health carrier can treat that as a reconsideration. And what that means is it goes immediately to external review. Again, adding more onus and time to getting the patient the treatment. So 561 is good, but this closes the loop on making sure that your doctor can talk until the final internal initial determination, if that's helpful.
Susan.
I think I understand the process, and it is very important to keep the lines of communication open. So, Michelle, would you see any downside, unintended consequences to this bill, or just in the event that there is questions with this process. It just facilitates additional communication. So what would be the downside of, or unintended consequence of this addition to the statute?
The only unintended consequence or potential downside is that it could create some inefficiencies. So if peer-to-peer is appropriate, then it should be requested, at the get-go, to make sure that the consumer is getting access to whatever they need. And if you anticipate there's going to be some nuances that really are need to be explained, then we would encourage the provider to request peer-to-peer up front. If you don't do that, then you've already started working through this due process system. And then, at the tail end, you're requesting it, and that maybe cleared up something that could have been resolved initially. We don't have very good metrics on how often peer-to-peer actually results in a change of the decision. But we are collecting data on that, and hopefully in a few years, we'll have some better metrics on how peer-to-peer plays into the entire review process.
So the way this language is written is that even after the appeals occurred, whether an appeal has been requested, so therefore after the appeal has been made, it says, because this says regardless of whether an appeal is made, a claimant can retain the right to appear to view. So it seems to me that you could have had that appeal.
Well, you wouldn't know you
And let's say
needed,
the appeal failed, but the way that I read this sentence says they can still request a peer-to-peer conversation after you've lost the appeal.
no, it only goes to the first, it stops at the end of the internal review
But that
process.
doesn't say that.
It's in the industry, it's understood. It does not extend to the external appeal process.
Wouldn't that need to say that? A claimant can retain the right to a peer-to-peer review within the window of the appeal process.
Says, I believe,
It says
Put my
regardless
glasses
of whether an
back on.
appeal has been requested.
it's at
But
any,
it doesn't say,
I think external review
says-
would be a whole separate process. It would have to say external review. So if you wanted to extend it to external review, you'd have to change other portions of the statute. I
Okay.
think
Which is
appeal is.
definitely not where we're going with this at all.
okay, so this is a short period, whether an appeal, I don't know how many different kinds of appeals we have. And that's why
one.
I was wanting to interim study this bill, because I'm trying to understand the appeal, this appeal versus the external appeal. So there's two different appeals?
No, you have your appeal. So the way it's currently drafted is you have your initial determination.
Right.
And then if you don't like it and you want to request peer-to-peer, that's considered a reconsideration of that adverse determination. That is separate than the appeal process. Then you can appeal it. That's where you have to file the formal appeal saying you're appealing it. And then after that appeal process, then you have the ability to go to external review. But there's
So-
only one appeal within the internal process.
So what this right would end once the appeal occurs, the appeal decision occurs?
Once the
No, once you're done with the appeal process, I guess. Well, actually, no, I guess it's kind of open-ended. 'cause
That's
it
what I'm
says-
saying. It's
No.
open-ended.
it ends before anyone ever starts an external appeal
How can you
this-
tell? How can you
bec-
see that?
because it's at any stage
It
of
it
the
just says
prior.
an appeal. It
No,
just-
it says at any stage of the prior authorization, which that
Okay, let
that's
me read the sentence
clear.
before. The peer-to-peer review may be requested before the new entity's prior authorization determination or after the prior authorization denial. After the denial.
So it remains it remains just for the internal.
And no,
Portion.
but see, you crossed out and before a formal grievance request has been made. So
A claimant retains the right to peer-to-peer review regardless of whether an appeal has been requested by or on behalf of the claimant. It shall be made available by the review entity within 2 days of their request. It does not, this does not have any relation to any external appeal process. It does not reference it, and it's being overcomplicated.
Are you confident too that this request for peer-to-peer ends, this window of time ends when the appeal ruling is made?
Not necessarily. I think another just technical thing is within 420J, appeal is not defined, it's grievance. So I would say either use the term adverse determination would probably be the more appropriate term, and then putting in that time frame because it does kind of leave it open-ended. There are time frames for when you can request an external review, but deleting that one portion and adding something else kind of just leaves it open-ended. So if you didn't go to external review, would that mean that, in 6 months you can request the peer-to-peer? I think that's just a technical drafting thing that you would want to correct.
How would you, what would you say there?
Sorry, I'm going. I guess if you put a claimant retains the right to peer-to-peer review, regardless of whether an appeal has been requested, well,
Prior authorization process ends.
I think you could say a claimant retains the right to a peer-to-peer review through the appeal process of an adverse determination. And then at the end of that appeal process, that would essentially be the cutoff.
Agree.
Okay, so let's see if we can get this done before our exec session today. Okay, claimant retains the right, so we would insert, where would you insert this? Because whether,
I think you would want to, where the amended language says a claimant retains the right, you would just change that sentence to say a claimant retains the right to peer-to-peer review through the duration of the appeal process.
okay, through the duration of the appeals process. And then, so instead, and not bother with whether an appeal has been requested about that part, just.
Yeah, and just delete the rest of that sentence.
Then delete, so a right to peer-to-peer review. Okay. Through the duration of the appeals process. And then delete, delete. Okay. How did everybody else feel?
I think it just keeps the lines of communication open, right? Regardless of, if it's practice or not, it just keeps it, Okay, we have our consultant.
Okay, insurance companies want to weigh in then? Okay.
I don't know. We haven't seen the amendment. I think.
So.
Is it this one
No,
line?
no, it's not in the amendment, so now what you need to do is pull out the original bill.
Okay.
If you look in the original bill, okay, in the original bill on line 12,
Mhm.
it says a claimant retains the right to a peer-to-peer review and removing the regardless, removing the rest of that sentence and replacing it through the duration of the appeals process.
I just want to clarify that if somebody, so currently if a provider wants to talk to a carrier during the appeal process, they can. But because there's already so many rules and regulations around the appeal process, we can't change the decision. The appeal process is moving. A provider could still speak to a carrier. I also just want to clarify that I think there's sort of this notion that peer-to-peer is a chance for a provider to like advocate and argue on behalf of a patient, but that's not really the purpose. The purpose is for the provider to potentially add new information that wasn't there before or clarify something. But it's not like a provider could call up a carrier during the appeal process and, you know, make some novel argument or something that's going to change the course of what's happening with the appeal. Once the appeal process is in place, we have to go through that. That is good for the member. We want that to move along quickly. So I just want to be clear, though, that if a provider wanted to call, we obviously, our team would talk to them. So that is the current state of affairs.
So you would, as far as you're concerned, this is already occurring.
It's not an official peer-to-peer review, I don't think, but they could certainly speak to the carrier because what Michelle just explained is the process is peer-to-peer, then appeal, then
Right.
external
So
review.
right now, what is that when they call back, they're gonna be getting that person who signed off on the denial. But this is saying we want to go beyond that person who signed off on the denial. We want a peer-to-peer conversation.
Well, so I think a couple of things. When you have an appeal, right, peer-to-peer is over here and your appeal is over here. And
Right.
the reason why your appeal is on a different track is because you're having a provider, an independent reviewer who hasn't been involved yet,
Correct.
look at it on its face and say, should this have been approved or denied? And so from the carrier's viewpoint, if you're trying to, in the middle of that, change the determination itself, then the appeal process has to start back all over again. And so then you're creating delays for the consumer in getting a decision out of the appeal process. And so then it kind of mucks up.
You could muddy the water by
that
having this
system.
peer-to-peer
Right.
conversation.
I think the
And would
other,
it, and then the other question is, would it restart the clock?
It's
don't know.
confusing because we have to already follow rules and regulations around the appeal process. So I think we'd have to finish out that appeal process and then I think this muddies the water in a way that's really not helpful. And I also think it's important to point out that the bill still adds this whole new paragraph that has, the regulations around the specialty, but it includes things that must be submitted by the physician reviewer at the carrier. This is starting on line 21, this new paragraph. So that's pretty significant. And I think we have concerns about the safety of our providers if we had to disclose all of these details every time a decision's been made.
The name of a provider, their NPI number, those are not private. It's not private. That's very public information. And that's something that your own doctor should be able to find. When they speak to the doctor at the plan, they should absolutely know who they're talking to, what their NPI number is. NPI numbers are everywhere so that they can reference back the dialogue that they had. Otherwise, they have no way to get a hold of the same person. There's no additional requirements on the physicians. It's basic data. It's like saying your name and your date of birth.
right, I think in light of the United Healthcare shooting, providers have safety concerns with that particular provision, especially disclosing their own personal information.
And would
There's
you
a safety concern
believe
there.
that every claim detail, every EOB has the NPI number on it? That is the identifying number
Right,
that
for
they
the
put on all
treating-
their prescriptions.
For the treating provider, yes.
So,
We're talking about the
that's-
reviewing provider, and I think that's where
And that's part of also
there's the issue.
recognizing that you're not talking to, again, back to the most absurd example, but that's also to make sure that your treating physician knows this NPI number does match with a doctor of similar standing, if you will. But NPI number is not a private, it's not a HIPAA, it's something that's used to identify a doctor in all insurance documents everywhere. So that's definitely not a concern. It's already
Well,
done.
it would be a new section of the law, though. So I guess, I think if you want to make this small change, I don't think that I think it muddies the process, which is already highly regulated. I feel uncomfortable with this new paragraph that would be added, which does add quite a bit of new language to an already highly regulated area.
maybe you didn't see the amendment. It says or. If
No,
to
I
have
understand that,
this
but
plus
the bill,
or,
but
or.
the bill has this
Right.
whole new section.
Do you really need that whole second paragraph? Is it the second paragraph?
So other than the
Section two.
physician's name, specialty, and NPI number, what is the offensive piece to that part?
So just one thing I did notice in that part, the first paragraph is upon issuance of an adverse prior authorization determination, an insured or their provider may at any time request and receive peer-to-peer. And I think that gets back to the timing question of during what duration, during what duration? It seems like that would be open-ended.
I think actually
Yeah, we told
Michelle
that.
from the DOI answered that very clearly. And we already agreed to a change in the language there.
This is,
Then I noticed
So-
this
This
is
is a
also
different
reprinted in
paragraph.
section 3 of the bill. Under utilization review.
We can make the language the same there as well.
Well, I'm just saying that.
We were-
Is this affecting the same thing, Michelle? I mean, that section 3, is that the same thing? Is change, do we need to change both sections, or what's the difference between section 1 of the bill and section 3 of the bill?
One section is in 420J, that's for your managed care plan.
Yep,
Mhm.
And then 420E is for utilization review entities.
okay, all
Yeah.
right.
Yeah, I agree.
And again, I think, have listing an MPI, I can check with that, but I do know there's significant concerns upon listing someone's full name, and those types of personally identifying details in the peer-to-peer review. I also think just in terms of drafting, I think Michelle probably knows more, in the insurance statutes, I think they say insured rather than claimant. And like somewhere I saw the word item or service, but I don't think item is the right term. There's a couple
So
just little technical
what I see
changes.
right now, your amendment that you gave us, which is section 4 of the
Yeah.
bill.
Mhm. Yeah,
So,
that changes.
so I'm just saying is, if we were
Mhm.
to go change this sentence in section 1 of the bill and in section 3 of the bill,
Mhm.
assuming we leave section 2, that section 2 is that seems your stripped down minimalist requirements. So just get rid of section 4. Would you be okay with that? That would be easy enough to get this done today? If you just get rid of section 4?
As long as it doesn't change the intention.
I assume,
And yes, I think it's the same. Unless it's under a different RSA though, so I think
right,
they
this is
both
the
just need to read.
J6, this is the J6. part.
What number is that? What line number?
So I'm on page 2, line 31 you see that little 4 there?
Yeah,
That's the magic number. Took me years to figure out how those little sections are designed.
you already flagged section 2 has that same problematic language about the anytime. So it's the same language as section 4, but it's also in section 2. Just
Where's
sections 2,
we're
is
in section 2, because section
line
2,
24, this is the 420E section.
okay, yep,
It's may at any time request. That's the same as section 4, which is 420J, has may at any time. I'm on page 2, line 34.
okay, so it's 25, the insurance shall honor such a request regardless of the appeal status. So that's line 25 you're looking at.
No, above, there's on line 24,
There's
the provider,
line
yeah,
twen-
yeah, yeah, sorry, may at any time request.
Right,
That seems open-ended.
it's the same, it's gonna be the same as the previous. Through the duration of the appeals process,
Okay.
the same
right.
language.
So everywhere it says, it retains the right to, every time it starts with regardless. Okay. So we get down in here, and again, regardless, every time it says regardless,
I think we'd probably, so I think my concern again is, does this then restart the clock on the appeal process if there's a change because of the peer-to-peer, but the appeal already started? Then does the appeal start over again? And so now we're having more
again,
delays.
yeah,
No,
it-
no.
I've been assured that that's not going to be a problem, but
Also, I
what
just
do you
want to
think,
comment.
Michelle? Is there a potential the insurance companies are going to restart the clock?
Yes, because the appeal starts from when you've received all of the relevant information. So if they supplement it with more information.
In that peer-to-peer,
then the
they're
clock
supplementing?
restarts. And so it could have an unintended consequence that I didn't catch until they mentioned it, of actually slowing down the process.
So that's what you want to do? Slow it down?
I know from my work in the field that I'm confident that this is the best fix for the gap that we have now. Yes.
But wait a minute, we're about to do something that your field doesn't do. We're about to
We're
say,
allowing-
about to drop in a peer-to-peer review,
Yes.
and that peer-to-peer review, the assumption is there is potential of new information being
There-
transported.
There always is. That's
And
not change.
And that really would say to me, then you're restarting the clock on the appeal because just help me out here. All right,
Mhm.
the nurse at the front desk just hit the appeal button, send it off. Okay. Well, doesn't when she did that, doesn't she supposed to put some information in when she did that appeal? Okay.
Mhm.
Now, the doctor, says, well, gee, if I could just talk to the medical director or talk to somebody and explain this other piece that was not in the appeal process.
That's the whole point.
That's what I'm saying is that would then, that new information is potentially starting the whole clock of what
Chairman,
the
I think,
appeal is going to be.
Yeah, can I interrupt for a second here? I think what we're focusing by your talk and now we're speaking on that is that this bill is not talking about peer-to-peer review only during appeal process. It is saying that till the appeal process is over, you can do that. So you can do it out before the appeal process even started. So this is
That's
allowing.
already true. That peer-to-peer can happen now prior to the appeal process. Her thesis on this whole purpose of this bill is that people hit the appeal button too soon and don't give the opportunity for the physician to have that peer-to-peer. Have I
And
got
the
it right?
patient may not even know that occurred until it's too
Exactly.
late.
I got it right.
Yeah.
That her issue is that
Only
that-
during appeal process, you're saying?
that the peer-to-peer, she doesn't even know if the patient or the physician will even dawn on them to have a peer-to-peer, okay? And so that because they had already begun the appeal process.
Yeah, it could happen, like it can overlap, but it is not saying that you can do peer-to-peer review based on this bill, that you can do only when the appeal process has started.
Here's
You
the
can do
question I
before
have.
also.
Here's my question I ask you, okay? Somebody's filed the appeal.
Please don't.
And they got this data come in, all this information they think is what, for filing the appeal. Meanwhile, they then go and have this peer-to-peer conversation. And in that peer-to-peer conversation, there comes up this other issue that wasn't in the appeal. Is that still legitimate information for the appeal? Or does that restart the clock on the appeal process? Or that because the peer-to-peer conversation has begun or been scheduled, does that say the appeal process has to wait
No.
until after it?
There's no change in the time frame.
I understand that that's what you want it to be. I'm just saying is process-wise, how can you make an appeal decision if new information is trickling in?
That's the same whether it's before or after. It's just so your doctor can advocate for you. If you have specific genetic mutation, they can talk to the plan and say, you know what, this particular drug or treatment actually isn't the right one for this particular person. And that maybe didn't come up until a follow-up lab occurred. This is just so they can talk, your doctor can talk to the doctor at the plan and advocate. That's it. This is
That's what
becoming,
I thought happens
this
in
is
the
becau-
appeal process. I thought that happens in
I
the appeal.
understand, but it only happens between the initial denial determination and the time the appeal is initiated. Currently, it's a small window. This bill is simply to
I think-
open up.
You know what? I'm going to pass this bill, and I will bet you, we are going to get complaints from physicians that they don't, that the insurance companies will manipulate the situation to absolutely deny in the appeal process that peer-to-peer conversation. Because they're going to say that wasn't in the appeal. We didn't get it. That was a conversation those two had. It has nothing to do with the appeal.
This can
You're
make
saying
it.
I think
that conversation now has to be part of the case of the appeal? They have to take that conversation and it has to be part of the appeal filing? If that's
it's
true.
already
that's
part of the
that's-
documentation process. This is not that
No,
complicated.
that's what I'm saying. The document process is when you make the appeal.
If you have a denial for a procedure, your doctor can say, this patient really needs this procedure. I want to talk to a doctor at the insurance company to explain my particular patient's need, period. If the appeal has already been initiated, press the button. Your doctor loses that
Now
opportunity.
you're repeating yourself. We got it. We
Well,
understand that.
okay.
That is not the point.
Okay.
The point we're trying to make is that what is gained in that peer-to-peer conversation, does that become part of the appeal?
It is in the current, it's no change to that. It's simply a
So you're
conversation that
saying
can
is it
happen at
doesn't-
any
so
time.
They might agree in that appeal, they might just say, yeah, this is fine. But then when the appeal, in the peer-to-peer conversation, oh, this is all fine. But that's between those two. It never becomes part of the appeal.
Of course,
Because it's a separate file. It's a separate
No.
process.
no, it's part of the same process. Just the discussion can happen between the initiation of the prior auth and the end of the initial prior auth, just like Michelle
Okay.
said. Just
So
like Michelle said.
maybe,
She's
maybe
right.
the way to handle this is that we're saying in an appeal filing, in that appeal, then a peer-to-peer conversation is required.
That's a mandate.
The whole thing's a
This
mandate.
is to expand access and expand opportunity. That's it.
It could be allowed, so it will make it more informative.
I'm
Oh,
just saying is that I'm a lawyer or a judge, but when it comes to case law, when you're dealing with a filing, and you're saying I'm dealing with what is in front of me, okay? So we're saying is, oh, by the way, we had this other peer-to-peer conversation that occurred after what you're looking in front of you is the appeal. The language of the appeal, everything you thought in the appeal. I have to admit, I thought in the appeal process, there was a hearing.
I don't think there's a
Is
hearing.
there
There's
a
no-
hearing?
No, you submit
There's no-
documents, they review
There's
it.
no hearing, right?
Not for the internal
In
appeal
the appeal
process. You
process,
might be thinking
right.
of the external.
When you go to
review.
external, okay, so I'm
We're not talking
mixing it up
external
again,
right
I'm
now.
mixing up with the external review. Okay, so in that appeal, that, we're basically, the person who's looking at the appeal is only looking at what they were given as in the appeal filing.
The doctor review can add more relevant information to the appeal process. That's all whole
How would
intention
they
is.
know? How would the person who's doing the
Because the
appeal
doctor is more
know that?
qualified, the doctor is more qualified to,
No, how, you're
Please,
the
don't
bureaucrat,
talk.
you're the bureaucrat in Indianapolis. Excuse me, Indianapolis. You're the bureaucrat, and you're looking at the appeal request. How would you even know if there was a peer-to-peer conversation actually occurred?
It's all under the same case number. There's no change. We're overcomplicating this. Let's back up. This is meant to be helpful to the patient, helpful to your doctor to advocate for you, and this is helpful in expanding access to care. And
I
if,
read-
if
sorry.
there's,
I think it's going to make the thing much more complicated, more and more problematic, and believe you me, the insurance companies are going to disappoint you greatly when it comes down to it.
this
because
is something that we did get a letter from a family physician from last night to the committee. I don't know if anyone had the opportunity to read it, but he's practiced for over 30 years. He's obviously gone through a lot of appeals processes, and he is in favor of this legislation. So again, I hope the committee will consider and ought to pass as amended.
I read through that testimony from the doctor, and it was really compelling.
Chairman
Okay,
Hunt, can I clarify one last thing?
yes.
I just want to be clear that once an appeal is already filed, the decision can't be changed. So you could insert peer-to-peer or conversations, the appeals moving forward through the process. And the current state is if a doctor needs to speak to someone, they can. So I think the question of how does this potentially impact the appeal timing and process is a real one. And I just want to clarify that even if you add into statute that we must allow a peer-to-peer during the appeal process, it's not going to change the decision. It has to go through that process.
Right. Right, exactly. So you've done nothing. All you've done is make everybody think you've done something. Nice feel-good legislation. All right, we'll do it. That's
Or I
fine.
just
You know
have a-
what?
I have a
Right,
que-
We're
so-
out of time. We're out of time. We got to just do it.
But you
Just
would
pass
have to
it.
have a second, then you would have another appeal with the additional information? Is that what the issue is?
No, at that point, you would go for external review.
You
Or
can't have
external.
multiple appeals?
You would go for external
Right.
review
Okay.
after
But
that.
I
point.
One
think
shot at
the
an
other
appeal?
thing to remember, right, if new information becomes available, like in Representative Miles' example, right, a new test result comes in, something new comes up, a claim can be resubmitted with that new information. So that, and maybe that gets approved, right? There's nothing stopping the provider from resubmitting a claim with more information. Just as a separate standalone submission, right? I mean, after you've gotten a denial on something or something, and then it's been denied, the provider can still submit another claim with that additional information that came in. And maybe that's enough to get the claim approved because there's new material, medical evidence. So I think a lot of it is provider education too, about knowing they can hit the peer-to-peer button and not jump to the appeal button. And that may be something that we can, collectively work on together to help raise awareness and have, work with the department. They do a lot of public awareness, that type of thing. Even those sort of non-legislative solutions might be possible. in this
Okay,
case.
if anybody else have any more, I'm ready to move on. Ready? Okay, Representative, you get the voting sheet? We're just going to put in the one she submitted. At this point, let the Senate, let the Senate figure it out.
This one?
We're just gonna, we're gonna pass this bill with this one line amendment and with the language, I think it's gonna be extremely problematic, but it did. I might vote no. I might vote no. Exactly, I vote last, remember? So I at this point, I would normally never pass something that needs work. Unfortunately, we ran out of time, but she is insisting that she wants this right now and wants it done, and she is, right in her thoughts, and I certainly don't want a floor fight. I don't like floor fights, and just given the complication we have right now, who would want to drag the whole house into trying to figure this mess out? Okay,
And you don't think IS could be working? could
I
help
think
this?
IS was the right answer, but at this point, she wants a vote not to pass as amended. Well, that's the thing. The time to fix it is it's going to force us into tomorrow.
Making the changes, right? Those two lines change that we just talked about,
That one line change, yeah.
that one line change.
Exactly, but my piece to changing it is
The window period.
it's esoteric, I guess, in terms of what it really does and how it does. And And no, it has to be, we have to have this bill out of committee tomorrow. And so at this point, let the, if the Senate, I'm sure the insurance companies will and have that presentation to the senators and say that Representative Hunt was playing with the idea of that, changing this phrasing because it was incomplete. I'm sure that if this bill comes out of committee, Representative Miles will say that that sentence and phrase means to be during the process, through the duration of the appeals process. That's what it really means by you putting that in the blurb. That will be a judge would look at that and say that is what the legislative intent was. But
And-
it's such a minutia at this point for me to make an argument on that case and delay this anymore. And I'm done.
And
Talking
there are
about
3 senators on it, so I think that's probably an actually really good plan because they're invested also, so.
Not that any one of them knows anything about
Well, I'm just saying
Insurance,
that
but-
there's buy-in.
insurance.
Anyway,
Yeah.
thank
So-
you.
Okay, so Representative Miles. And who would like to second the motion? And
Second the motion.
moves ought to pass on amendment number 0805. And any discussion on the motion?
If we feel very uncomfortable, do we have to vote?
Yeah,
Uh,
go to the
Okay.
cafeteria.
You're
I
gonna-
can stand outside. I feel very uncomfortable without a decision here.
I hear you.
Yeah.
Some people want it today. They don't want to wait a year. Okay,
I'm not comfortable. I'm just not. I mean,
well, you're still gonna, well, we have the exec session. You're gonna walk out on the exec session too?
depends.
Okay.
Cocktails, maybe.
Right. Okay. All right. Okay, so so what we have left here is Purcelli, Miles, Sharissa, Hunt is who's left.
Here.
Okay. All right. So, all those in favor of the amendment, please say aye. You can't vote. Okay. I'll vote for the amendment. So 3. Are those opposed to the amendment? That's it for who's opposed? Okay, so you'll vote for the amendment? Okay, so the amendment is 4-0. Okay. Now the vote is ought to pass as amended. Okay. All those in favor say aye.
Aye.
2. All those opposed? 2. That motion fails. Okay. Now, open up for further motion. Representative Purcelli, second by Representative Hunt.
I think this decision was very influenced by the chair in a very, very unfortunate manner. And you pressured them in. You pressured them in. They feel pressure from you. At the beginning of the day, they were on board. They were happy. This was helpful. And you've pressured them in. You've pressured them out of the room because they feel so much pressure from you.
How did I pressure them?
And I've seen you do this with other legislation.
How did I pressure them?
You made them uncomfortable with this decision.
I made them uncomfortable with the decision. So we were unable to, because you guys left, we were unable to pass anything.
Okay.
So we're at a conundrum now.
I thought we were going to vote on interim study now.
So I'll, I'll make the motion of interim study.
So you want me to change it? Or is,
Well, you can, Priscilla can't vote on this anyways.
okay.
Oh, I'm sorry. Yeah, Priscilla, excuse me. Yeah, Priscilla and Hunt. Yes, I'm excused. You did. Yeah, I'm sorry. I wasn't. Priscilla and Hunt, and is the motion is interim study. Okay. So, all those in favor of the interim study, please say aye. 1, 2, 3, 4. Those opposed? Okay, 4-2. All right. And we'll take that up as a full committee. All right. Moving right along. Okay. I lost my amendment sheet, but, okay. Which one's 1630?
She gave us an amendment.
Okay, so we have the amendment in front of us.
0785. Yeah, she passed them out.
Uh, oh, here it is. Okay, all right. Who does not have a copy?
She passed them out earlier.
Okay. Sure. Yeah, oh, okay, so I don't know if there was, I seem like I have enough of them here, so that's
It's a one
for
pager.
that. I'll just keep a couple.
Sorry.
No, evidently didn't get passed out. Okay. So, is anybody in the room who's interested in this bill not have an amendment? Okay, why don't you come up here and stand here at the end, and once they've handed it all out, you can then collect it. Okay, so what needed to be corrected? Was- what do I do with my notes? Okay, so just everybody, a reminder, we are not banning nitrous oxide. We're not banning it. All we're doing is saying that those people who are regulated by the Liquor Commission related to smoking and drinking and carrying on, that if those licensees are barred from selling it. So in that last paragraph, paragraph 4, excuse me, the paragraph 3, so Roman numeral 3 is that it said some are convenience stores that might actually have whipped cream. So
So you are banning the convenience store, gas stations to have this, right? Because they
that's
don't have
correct.
license.
That's what we're doing.
Okay,
The convenience.
They're banning the whipped cream now, but not the other stuff?
No, I'm saying if the convenience store sells cigarettes and liquor
Is licensed.
and they're licensed, that they can sell whipped cream. They are allowed to sell whipped cream.
So that also
They
means that,
can't sell the ready whip, but they can sell the other, right? They can sell the ready whip, but the
Chairman?
one that comes in a can, right?
so Chairman, in that case, they will be regulated by, that they can't sell to under 21, right?
21 is our age for,
Cigarette.
well,
They
it
can
doesn't matter.
buy
We're just
cigarette.
banning them from selling it at all.
Yeah.
They can't sell at all. So it's not just 21.
No,
That's-
I meant
that's
the-
everybody.
Yeah, I meant the convenience store who is selling liquor and cigarettes.
Right
They can
now,
still
our
sell it.
liquor and cigarette law is 21.
Okay, so they'll be following this, okay.
So 20, but the age doesn't matter because this is, they're not able to sell it.
They cannot sell, okay, that's good.
But that's the
better,
reason
actually.
why the liquor enforcement is there, is to making sure that people under 21 are not buying products. But in this case, they also will take note if there's a section that might be selling cans that has nitrous oxide, they would not be allowed to sell those.
Okay, so let me ask you this question another way. So under this amendment, who can sell this?
Under this amendment, if you wanted to if you did not want to sell cigarettes and
No, no,
didn't want
I
to sell
meant-
beer,
Yeah.
and you are a store, you're a clothing store, you could be selling it
Automotive.
Why they can sell?
because they aren't licensees. So what happens here is that the most important element of creating a law is enforceability.
Okay,
And so therefore, the one thing we have enforcement requirements is people who sell cigarettes and beer. Enforcement agency is the Liquor Commission. This goes back to John Hunt's rule of licensure. The only way we can regulate something is to license it. Okay? In this case, they are licensed. We have regulatory authority, and we're saying is, no, you cannot sell this product. But in terms of if you are anywhere other stuff, now I would say, I would add in, that also includes restaurants would not be able to sell it because they're licensees. But yeah, if you were,
So the mom and pop shop-
If you're a clothing store or a tire warehouse, maybe they put nitrous oxide in tires. We do know they put nitrous oxide in cars, and auto parts probably sell nitrous oxide. That they're free to go ahead and sell it.
What about the kids in those instances?
We don't regulate them. So the problem was, if we wanted to, in other words, if we were going to say, oh my God, we don't want you guys to be selling nitrous oxide that you would normally sell to zube up the car, that we don't want you to sell it, then we would have to issue a license for them to sell the nitrous oxide.
So that's for another time, maybe.
That,
No, I mean, in the clothing store example,
right.
if they're gonna sell it to a kid, I have a problem with that, but this is
Yeah.
what we're dealing with.
That's today. I'm narrowing it to that is which is enforceable.
so this is a good first step, but we probably have to do some more work later on
No.
down the line.
No, you shouldn't do more.
You want kids?
I am pretty sure that customers who are found out that establishment was selling nitrous oxide to people under 21, they would boycott the business. They would make sure that their business knows that they think that's inappropriate behavior.
Under 21 would be in there.
All
All right,
if there
we'll
was,
save that for another time. But I think that doesn't make sense, but
well, it's just how am I going to enforce it?
I understand, but we'll look at it another time. And maybe in another committee.
Right, maybe in the criminal justice committee, if they want to have law enforcement, we have one, we do have a law enforcement guy. And he can just say, yeah, he wants to, because right now, we do have that inhaling law. Remember when we were doing this bill, we had a section that was dealing that you can't inhale, you can't huffing. Remember, so the huffing law is still on the statute. So,
It's like what Bill Clinton said, I didn't inhale. All right, let's go.
Okay, is everybody okay with what we're trying to do here? Okay. I'll move and Representative Burrows will second. Ought to pass on the amendment 0867.
This is just the liquor commission?
So this is anybody who has a license.
No, but I meant
It's Liquor Commission.
Oh, the liquor, oh, yeah,
Subcommittee.
correct. This is the liquor subcommittee. Yeah, thank you. Okay, you want to read the names on that list?
On this one, sorry. Representative
Patusek,
sorry.
Burrows,
Burrows,
Walsh,
Walsh,
Sullivan, Post,
Post,
Spear, and Hunt. Okay, everybody's here. All right. All right, the motion's been made. Any discussion? All those in favor, please say aye. 1, 2, 3, 4, 5, 6, 7. This is the liquor subcommittee. Don't use the word commission. That's very confusing. Okay. Okay, vote 7-0. Okay, Representative Hunt, second by Representative Burrows, move to pass as amended. All those in favor, raise their hand. 1, 2, 3, 4, 5, 7. 7-0. Okay, we're all good.
Hey, John. You said in our last, before break, that we would deal with the 1146, and I did have an amendment. You never included it on the work session today, so.
Oh,
And you
11:46.
just put it right on the exact calendar, and you said you wouldn't do that.
Oh, I was put, you wanted a subcommittee.
Well, I wanted, because I told you I was
Well,
gonna
we
come
kind of
up with
messed up on the subcommittees anyways, because then it turns out we also did have the propane amendment in the
Okay, well,
subcommittee.
I'm just saying I would like to
So you
talk-
want to talk about that one? Okay.
And just before we exec it today, so if we want to do it today, or if we want to use the exact time to do it, that's fine, but.
All right, so what have you cooked up here?
So this is for the subscription thing that was so heated last 2 weeks ago.
Yeah,
I sent it around everybody. And so based on our communication this last 2 weeks ago, one of the things that people pointed out, which I thought was fair, was some of these features require ongoing connectivity, like say cell phone services or whatever. So the way this language is, I think it's pretty clear, but it says that anything that is already installed in the car and simply, and should kind of think about it, it would work in airplane mode, should still be able to be used because you paid for that thing. A good example with like automatic starting is Toyota. It's documented. They have the app to turn on your car from your house, which requires some sort of cell phone because your car has to be connected to the cell phone. But they also have it on the fob, which is a different system. It's just a radio connection, right? It's like a radio wave, and that's already installed. And so to just use a software to shut that off would sort of be in violation of the way this would be. But there's a lot of other things, I know it didn't happen in New Hampshire, but, I actually like the fact that BMW did what they did with their heated seats because it shows the capability of what they can turn on and turn off with respect to hardware. So while that didn't happen in New Hampshire, that's another example of things that have happened. There's other examples I can talk about, but, I think the one that I've seen the most is the Toyota key fob stops working unless you pay for a subscription to start your car. So this, you can read the language, I think it's pretty clear. Anything that requires ongoing connectivity, like a cell
so
phone.
what you're talking about is this on the phone. You're using
No.
your phone to
So that,
unlock your car.
that wouldn't be impacted by this because your phone requires cell phone to send a cell phone signal to your car, which is connected
Correct.
to the cell phone.
right.
What I'm saying is if you have on the Toyota key fob, you have a button, you press it from your house and you're like, whatever, 100 feet away, you can start your car.
Okay.
That you would not be able to charge a subscription for that because the equipment is in there and there's no.
So are they charging a subscription for
Yes,
that?
they are. Toyota is.
Toyota is charging for.
Yes, so
that
any
service.
remote
So
start,
who do we have from Auto Guys here?
any remote start, I mean,
Okay, we don't have any Auto Guys.
I mean,
here.
I know
Okay.
this is the one that people reach out to me the most about. Is like my fob doesn't work, and they even say to me, I get the idea that if my phone is using an app that is connecting with a cell phone to a
Right.
car that's connected to a cell phone to make it work.
So how
But
much,
think
how
about
much
it
do they
this way.
charge for the fob to work?
I don't, it's all one thing. It's all remote start. It's like, you
Right,
can't just
and
get the fob to work independently. It's like the cell phone part. So that, I think somebody told me it was like.
Well,
$9
if
a
it's,
month.
if it again, if it's still related to, you had to have the cell phone communication.
But you don't. That's my point. That's entirely my point. So if you're using your phone, yes, because my cell phone goes to the car, which connects to the cell phone. That makes sense. What I'm saying is if I take out my clicker on my
Stop.
key,
Right,
press the button,
right.
like the traditional the way.
But if you're too far away,
then it won't work. Just like old ones didn't work. But here's the way I think you should think about it. Because I thought a lot about this after our conversation. If you're parked at Arethusa Falls in Crawford Notch, where there is no cell phone company that has any service, your app wouldn't work to start your car, right? Because it would need cell phone service and your car wouldn't be
the
connected.
card needs to be.
The
open.
fob should still be able to work in that situation, but it wouldn't unless you're subscribing to it for starting the car.
I understand. I
Because you understand the
You're
logic.
saying that the design fault is that it always requires to have internet connection.
Yes, and what I'm saying is anything that requires internet
I think
connection,
yeah.
anything
I
that
think,
requires.
I think you're
Just
chasing
keep
your tail
listening
on
to
this
me.
one.
I feel like you've made up your mind. I understand, but
No, I am absolutely listening to you. But here's my point. Okay. Yes, my Volvo had a button so that I could push and start the car.
Mm-hmm.
But if I go too far away, that button doesn't work
And
because
that's-
I'm too
Yes.
far away.
That's
of
fine.
course,
That's
I don't dispute
So
that.
then-
Why is that
so-
crazy to you?
But I'm saying is,
So what I'm
you're-
saying is it's
that
nothing about distance, John. We all understand
I
the
have not
technology
heard
of it.
from Toyota say that we don't let that fob work,
The fact
regardless
that
of how close you are.
I'm telling you, and I'm not lying. How's that? Can you trust me?
Oh boy,
Yeah.
you're.
Have you caught me
No,
in
if
lies?
we get the Toyota send us a letter in the next week and say no, that's not true.
Can I comment here? Just be like UN ambassador for a second. The difference that he's talking about is what's on board a car
It doesn't
and
require
the
connection.
ability to
And I
work
understood that problem.
versus the
No,
the
I
cell.
have absolutely understood that problem.
Oh,
Was
so
that
what
it
does
was
matter
already
how
built in.
far?
It was already built in to be that way. In other words, that this fob
Right, it's part
was
of the
always
car.
designed to
Work.
to not work unless you paid the fee, even though it's built into the car.
Yeah.
In other words, that if I choose, I don't want to have my phone. I don't want my phone to be connected to my car whatsoever. But that he's contending that then again I will lose out on the opportunity to have this automatic starter because I don't
Because
have
you
the
don't pay for
button.
the subscription.
Okay,
So,
right,
and that is,
so
and
I
that,
get-
so,
See, I
but-
do get it.
So what the bill says, well, you started, I think you confused us when you said, well, it doesn't work if you're too far away, but that has nothing to
Yeah.
do with it. That's just, if you're too far away, it doesn't work because it doesn't work. Just
That
like
was-
the
that
cell
was-
phone won't
that
work
was
if you're in the,
extraneous.
if
That
you're in
was
the notch.
extraneous. Yeah.
So what I'm saying is anything that is installed in a car, the
Right.
hardware is installed, it's connected electronically, whatever, and we just simply shut it off. You paid for that equipment, whether it's sensors, whether it's
Because it's already built into the car.
right, whether it's
That was
lights
the
that
car,
are
that's the way they
capable.
manufactured.
We have a problem.
Right,
Business with the battery life.
right.
The battery is in there, it's installed, but they don't want you to go over a certain speed and it's like 100 miles an hour because you're going to kill the battery and then you're going to have to pay more for the warranty. So
Exactly.
there is something that's installed, but you didn't pay for them to supply your warranty. You didn't pay for that.
Right. Well, you did is when and you said to them, gee, why can't I go 100 miles an hour? And they said, well, you have a governor in there to help the battery, to
reason
save
is,
itself. So if you
It's not
want,
just that you didn't pay for the cell service, it's
Right.
you also didn't pay for the warranty service either. So you need two things in there.
So here's the thing though. If you have a governor,
do you have a Toyota? What kind of car do you have? Yeah.
Yes and no. I drive a plug-in Jeep there.
Okay, because
So-
right now we're debating whether Toyota has,
it's
has
oh my
built
God.
into the car.
It's like amazing to me that we can get derailed by an anecdote as if I might be making something
No,
up.
no, here's my problem.
I'm well
Here's my problem, real
researched on
simple.
this.
If we were to pass this bill, if this was to be signed by the governor, Toyota would stop selling that car. That whatever car, if that's true for all Toyotas, you would be hearing hellfire from Toyota dealers because they're going to say is the state of New Hampshire is banning our cars. And if
I
that's,
don't-
if that's
I
what you
think
think is
that's
going to happen,
hyperbolic,
you think, so you want to just pass it as a house and then let the Senate kill it? You know,
I
but
want to
like you
pass it
say,
because I
the
think
governor's
it's,
going to kill
I
it.
think it's the right thing to do. I think if you are paying for equipment, like, you and I talked about free market, right? And free market principles are based on the idea of well-defined property rights.
Buy the car, don't buy Toyotas.
It's like I'm talking and you're not listening.
I
You're-
am
A,
listening.
you're
Yes, he is
interrupting.
listening.
A, you're interrupting.
Okay, that is true. I was rude.
You're being a
I'm
little
rude.
rude, but I'm trying to act in good faith. So that's a
Okay.
little frustrating as well, right? I
Okay.
respect you, John.
God.
Show me a little respect in this moment,
I will.
please.
I will.
What I'm saying is the principles of free market require well-defined property rights. And when you buy something that has equipment that costs you money because they didn't install it for free, and then you don't get access to it, that there's something wrong with that. And I think if we look at the BMW example, which I know happened in Korea, not here, that shows that the capability is to shut off anything they want now because of the way technology works now, where they can shut off anything they want. As Keith said when he was here, what we would call rent seeking. It's like putting a fence across a river so that you can't use the river without paying a tax, right? Or whatever, a toll to go through. That's rent seeking. You're not actually doing anything. That's what these companies are capable of doing. There's been examples around the world and in some cases in this country where that's happened. That is not how, that's a market failure. That is not free market success. And that is my argument. I took everything you said, every point that everybody said that was really valid. Like, hey, there are ongoing costs to pay for ongoing subscription services for cell phones because we know that GM or Toyota, whomever, is having to pay the cost of that car having a Wi-Fi hotspot or connected to cell phone to do over-the-air updates. That's all valid, so I'm fine with that. But for a feature that doesn't require ongoing connections to internet, or whatever, like the Toyota is an example, one of many that I've been able to find, then that is all this bill touches. It doesn't touch the other things. And that's the point of this bill.
That's fair enough.
Wait a minute.
Wait,
Wait,
hold on.
I don't
who's going?
agree. I just so you know.
I know you don't agree, but
don't
I
agree.
just want to make it clear.
Yes.
Who do you want to talk?
Whichever one you want to talk first.
Okay. I just have a suggestion, Jared. What do you think about this? I have a problem with the wording already installed, but what if we changed it to anything that was necessary for the operation of the car or its safety?
What does that do?
Well, I mean, you don't need heated seats. I mean, it's not necessary for the.
Okay, so the reason I say already installed is because if they install heated seats on your car, then you've paid for the cost of that equipment and you don't get to use it. So you've already paid for it because, your car isn't saying, oh, we're going to pay because heated seats cost more than non-heated seats, right? So they install them because there's extra elements in there or whatever. You're paying for that in the cost of the car purchase. And then they're saying, but if you want access to it, you have to pay.
What about Sirius Radio? I mean, how do you compare?
Serious, that would not be.
No, I understand that, but how is it different?
It's different because you need to go to an other company to provide that service that you need. Whereas there's no external heated seats company.
Yeah, I would say there's correction on that is that there is now some radios that it's high fidelity. It's like a different wavelength or something like that. And yes, there is a monthly fee, you pay for it, and it could be put out by the company itself. So it's like, the example was given to me by Mark Brown was that 4D or 4K, excuse me, I don't have one of these yet, but the 4K TVs, that DirecTV has a whole separate channels for 4K, and you have to pay extra to get it. So that would be the same thing. If you want 4K
Then you have to
sound,
pay for those extra.
you've got to pay for that.
And
And it
that
might
wouldn't
be, it might
touched by
be through the
this.
manufacturer itself. might
But
be.
even that, I think it would be fine because you're having to pay for something that is coming from somewhere else. It's not like,
I understand your nuance. Representative Spear. Now you just turn your mic off.
For the most part, I think the bill as amended is okay, except for the one case that I'm worried about in the fact that warranties are very expensive. And if you don't want to pay for your warranty, then you shouldn't be able to use, the thing with the battery life. It can't be just because you work as a, like if you were in airplane mode. It has to be airplane mode plus warranty or something. It's just a little too broad for me. I just want to add one thing, just add the warranty thing in there.
so what, just to be clear, are you telling me that there are cases where software is being used to keep it within warranty?
Yes,
And then are you
with the
saying,
warranty that you're willing to pay for.
You talking aftermarket warranty?
Nope. I'm talking about original car warranty.
because I mean, original cars, if it's not aftermarket, they normally just come with a standard warranty and there's always
No, apparently on high-end cars, they don't.
So what are you saying? You're saying that if you pay for a warranty, then you have to abide by those warranty contracts. So if that requires,
But they don't change the battery out of the car. Batteries are about 30 grand. They're not going to make another line to put a smaller battery in there. They're not going to do
no,
that.
I understand, but what, are you telling me that you found examples of warranties being voided by?
They're not voided, and that's not what I'm saying.
So
They
I'm
put a
trying to follow.
governor in the car so that you just don't have access to the speed that requires a warranty that will let you run the battery down that much more quickly. Because the battery will run down depending on how fast you go.
So you wouldn't have that anyway. I guess I don't get it.
Yeah, I'm not.
My 2 cents in, I think what you're talking about, Kerry, is if I went and bought a washing machine, they go to pay for it, they say, do you want an extended warranty?
No, I'm not. I'm actually not saying that.
That's what it sounds like.
Yeah,
Right.
no, I'm not. Options.
So Representative Sullivan, if you could please help me, I don't recall if there's full disclosure to the consumer prior to buying the car that these are all the features that you will not have access to unless you pay a subscription. I want to make sure that I understand that you're not finding that out after the fact, that it's before you sign to buy the car. They understand, here's the list of features that are not going to be available unless you pay for it, regardless if it's hardware, software, anything like that. Do you know if that's required?
I don't, I would like to think that there's some sort of disclosure. I've talked to probably at this point 50 people or more, and nobody remembers ever it being disclosed. Now, that said, does anybody in this room remember what was on page 7 of a book you read last month? Probably not. So
Well,
like
but
that,
that's
it may have been
important. That's
disclosed.
very
I don't know.
important To be able to say, look at this and sign that you're not getting your heated seats unless you pay for it. So I think that would be important. The other question, I don't know anything about auto manufacturing, but I remember back in the day for Toyota, I had a Camry for 14 years. So, and it had like 450,000 miles on it.
Oh, my.
But in any event, right, they just, and we gave it to somebody, and it's still on the road. But anyway, would you believe? You used to have like a base model, a middle model, and then a luxury model. But what I've heard is that instead of doing that, they manufacture one, line.
Right.
And then in order to have these additional features, these are things that you could pay for. Is that accurate?
Yeah, so it does, so when you're doing manufacturing, it becomes lower cost per unit to just run one thing. It saves
Right.
them money. But the problem with that is it sort of takes away the starter, the starter car mentality, right? So because what they're not going to do is they're not going to build, okay, it does cost more money to build a car with, say, a heated seat or whatever. But Just realized I wasn't talking to the microphone. So it is cheaper to build something, one production line. But what happens is you're basically having lower income people are now subsidizing people who are buying higher income cars, because what they're doing is they're paying for features for the sake of having a more efficient production line, but they're not going to get those benefits. And so the marginal savings that they get from a streamlined production is going to not help the people who need that starter car. Does that make sense? So it does save money, but it depends who you're looking for. Does it save money for somebody who is always going to buy that high-end car? Probably. Does it save money for the person who really does need the base model and that no longer exists because whether they get access to it or not, they've still paid for that heated seat? Does that make sense?
Yes, I do, but I don't know why, as a consumer, I wouldn't be able to say I don't want to get a Toyota because these are the features I want. I have to now pay for them or I'm buying something else. So I'm not sure why, I'm having a little trouble with the,
So what this is saying is if you have a feature that's installed in your car,
Because it's not disclosed until you're buying the car. I could, with the full disclosure, understand what it is that, this is the offer for the car, this is what I'm paying for, and now if I want to use these features, I would need to subscribe.
and one of my problems, well, I don't know if that's happening right now, and
I
that's,
think it's not disclosed until you're signing the, that you're buying the car.
You are being aware that they're going to tell you that you're going to be charged $12.95 a month.
Right.
So
At
in
that
tr-
point.
to
I
that,
mean, a lot of
but
people
that
don't
is
'cause it's-
disclosure.
it seems to be mostly free for people, and nobody seems to, I'm not saying they're not doing it. What I'm
say-
saying is, every conversation I've had, literally every single one, it's been
Right.
a lot now.
Right.
What I've been told, and I'm not going to say that this
Okay.
is how it's working, but what I've been told is it's free, and suddenly they get a notification after owning the car for 6 months that if you want to continue to have this, you have to have access
Right.
to it. And it is possible it's not being disclosed right now. I mean, that is possible. I'm not saying it is, because you sign a lot of things.
You
and
sign a lot of paper.
and people don't always read, or you just don't remember signing it because nobody in this room remembers everything they signed the time they signed it, right? So, but it is interesting to me that not a single person says, I knew that this was going to happen.
Okay.
It's not solving the disclosure problem. I mean, you could put it right on the car, right, where you see the list price. You could put it right next to it. These are the features that you're going to be paying a subscription for. And then I get to choose as a consumer if I want to buy it or not.
Representative Spear.
When you buy a car, at least, and I haven't bought one in a long time, but they have packages, sport package this,
This is not a
high-end
part of that.
package that, this
Yeah.
and that and the other thing, and they tell you exactly what's in it.
Right.
And I would imagine that, for instance, that some of these things are going to be in those packages. I don't think that they, you're going to get the automatic door opening package or whatever you're going to get. So those packages are really
Joe,
total.
here's what I think is happening. Based upon the fact that you guys said you can look it up and Toyota says this is true. Okay? So I think it would be just like it happens to me all the time with DirecTV, is they say, we're offering you HBO free for 6 months. Yeah, and but they somehow never mentioned that, and then after that it's going to be $14.90 whatever a month. So I think that what's happening is that Toyota is that this feature that you're using your fob as being able to turn on your car is a add-in to why you would want this feature that you can start your car. Okay, especially when it counts when those 6 months are incurred, whether it's in the winter or summer. You might not even know about it or think about it. So in terms of disclosure, absolutely, I can see that maybe the Toyota is not being as so clear, pointed, and understanding. A person say, I don't remember that happening, because you bought a car in the summertime, so you never even thought twice about it. And then when it came time to use it, oh my God, it doesn't work. And you call up the dealer and say, why didn't it work? And they said, well, your 6 months is up. And so now you've got to pay that fee.
So my issue, Representative Bocelli, with respect to the disclosure though, is you're not solving, you're being double charged for something. You're paying for it once when you buy the car because the equipment is built into the cost of the car. And then you never get to own that equipment unless you pay a subscription inevitably. So you never fully own your vehicle. And it would be like buying a house with two bathrooms and then you never get to use the
Yeah,
bathroom. One of the
let me, here's the way I would, what this is that the fob, being able to start the car, is a throw-in to you signing up to have your phone communicate with the car. And it's sort of it's a throw-in. So one of the benefits you have if you pay us the $12.95 a month to have that cell phone coverage to your car, that not only will you be able to start your car or lock the car when you forgot to do it, you got on the airplane and you forgot to lock the car, and all the features of why they think it's wonderful to have this communication with your car, they can say is, oh, by the way, you can start your car ahead of time. All right. And the fob was just a extra because a lot of people were used to having a fob start their car. So I think it was a sales bonus, and maybe or maybe not, they'll do away with it if this legislation ever were to become law.
I don't know what their motivations were.
Yeah, but I can say at the end of the day, I'm a marketing guy, so I know exactly how these guys think. So I think it was a throw-in, and theoretically, if this law were to pass, they probably could figure out a way to change it. But at this point, I just buyer
I mean, I know
buyer
you're
buyer
probably not
beware.
being-
Buyer read all the details. Buyer, you got to know what you're getting yourself into. And if Toyota insists on doing something like that, then you have to say, well, that's fine. I'm gonna go buy a Hyundai.
Didn't expect I was going to convince you, but I just want everybody to understand my
I
position.
am
They're
absolutely
double paying
convinced
for
that you are absolutely correct and that this is absolutely happening. But at this point, I will still say, buyer beware. That,
Right, well, at
that
least y'all have the
don't buy a Toyota.
I think there's one other thing. I think one of the things I've been reading about is that this kind of thing is going to become a very competitive advantage. That is to say, well, we're not going to charge you for this. And as a result of that, our car is going to be this much less, but you're going to get it for free, whereas that guy's going to charge you.
It's right.
And I
It's a
think
marketing.
I think it's a marketing
Yeah,
thing that
exactly.
they're doing
But
for competition.
I would like to hear, I don't recall what the automobile lobbyist.
He told
what-
us it's not happening in New Hampshire, and then we
Well,
proved that that
because I
wasn't
would
true.
not want these manufacturers not to sell their cars in New Hampshire.
They're not going to
That would
not
be
sell
Well,
their
I
car.
would-
New Hampshire's a over $5 billion market. They're not going to just walk away from that tomorrow.
I will be speaking to Mark.
I think the salesperson has to do a better job in explaining some of these things to the customer, which I don't think they're doing right now, and that's why they're blindsided.
Well, good luck regulating that.
Okay.
So
All right. So
Thanks, guys.
so next we haven't done 1813. And I have just decided that after talking to Julie and knowing how important the other bill is to her, okay, that I am now changing my vote, and I'm willing to on that bill, when we exec that bill, what's the other one, with the other bill number 1406, that I will now support. I know 1554. 1554, the peer-to-peer bill. I am now being willing to support her bill with amendment, and with the trade-off that she is willing to let 1813 become interim study. 1813, which is the last one we haven't talked about, relative changes to health carrier contracts. I'm horse trading, yes. You vote your whatever you think is right. No, I'm just telling you that when it comes time to exec it, when we exec that bill, I'm going to change my vote on terms of the subcommittee. Okay? So, Representative Miles, this is 1813 now.
Oh, I'm confused.
The 1146 is, we didn't schedule a subcommittee on that anyway, so we'll just vote up or down on the exec session. Okay. All right, so this is going to the, this is the Health Insurance Committee.
So this does have an amendment attached, though, just so you know.
What's that?
This has an amendment. It was the
To
amendment.
remove section 3.
Mm-hmm.
Okay,
Yeah, that was the request, so
right,
that's
but at this
done.
point,
and-
we're going to just
and
do an interim
correct.
study on it.
Yes.
Okay, so Representative Miles, second by Representative Hunt. On 1813, relative to health carrier contracts.
So wait, do we vote on the amendment?
No, because we're just
No, we're
going right
just
to, we're
moving
just
it
going
to-
right to interim study.
All right, thank you.
Okay? All right, so this is the Insurance Committee, Briselli, Burrows, Miles, Teresa, Hunt, Spear.
We're not going to address any of the things that that the hospital association and the
No,
other
we're
people.
interim study. We're interim
Oh,
study.
interim study, all right.
Okay. All right. All right, all those in favor of interim study, raise their hands. 1, 2, 3, 4, 5, 6. And that's the end of that one. Okay, the only other one that I have, okay, that I don't know whether, the subcommittee did take action, but it's not on your voting sheet. So if you have whatever piece of paper you're using to go through the bills when we exec, there are 3 bills missing that we need to exec.
Yeah, right here.
Okay? Oh, they did print something. Okay, so there, I would to pay attention to that 3 sheets, and my process would be to just shoehorn those in. So in other words, we will take this up in the exec session. Okay? All right. We'll be back at 1:15.
We'll see. Still have little ways to go. I don't know.
Too bad the cafeteria doesn't have beer.
Hmm?
We'll have to suggest it.
I sure as hell could use one right now. I don't know. There's a ton of shit shows this morning. Seriously. That crap is wrong. Turn it into a shit show.
You still need to clarify this to them.
I think she is.
I'm gonna keep it high level and simple.
CD two.
He's
Yeah, we were talking about this. And it's right there that you don't have.
I don't have my voting sheets either. She's going down to get them.
Okay.
The green sheets. Told Robin this morning, she said, oh, they're up there. I go, no, they're not.
So what did you?
Those are two of the bills that,
Heating oil
yeah.
and banking. Okay.
Oh, we're gonna go
Beautiful.
by this,
Oh.
so I can fill it in.
Okay.
All right, we're gonna get started. Okay. Okay. All right, so yeah. Okay. All right, so we're going to go through the House calendar had the list of bills we're going to take on today. We did, through further review, we have 3 others that you might have this piece of paper in front of you, and I will try to insert them where appropriate. So we have 1262, 1347, and 1650. Okay. Which I believe when I sent this out to you, those bills were listed down at the bottom of the page. All right. Obviously, I want to go through this quickly. I think every bill has been thoroughly thrashed around. We know what we want to do. I obviously, Representative Stewart would like to discuss a little more about the auto bill, and Representative Miles and the what's the bill number?
1554.
1554. Okay, so we'll try to go through that. But I am looking, obviously, for someone willing to make a motion. All right, so Japanese knotweed. Who wants to make the motion? Right? What's that? Yeah. Oh, you would like to take up your bill right away? Okay, so which bill do you want to take up now? 1554. Okay, 1554. So 1554, which is the peer-to-peer bill. We spent a long time this morning discussing this bill. And as you all know, my original intention was to interim study it. But at this point, the nuance of the bill and what it does, that Representative Miles feels very, very strongly that we really need to pass this bill. So at this point, as much as I think that interim study was the right answer, I'm certainly willing to go along with passing this bill, especially since I hear the Senate already is going to attach it to some other bill. Evidently, everybody, there's a lot of activity. People care about this bill. So we'll start out with the amendment. And the amendment is number 0805 on 1554, which simply puts in an or in terms of actively practicing in the same similar field or medicine. Or. And so I have Representative Miles, seconded by, who would like to second it? Representative
Shorassi.
Sharisa, okay. and moves ought to pass on the amendment for 1554, number 0805. Any discussion on the amendment? Thank you very much. The clerk will call the roll.
Representative Patuchek,
Yes.
Representative Osborne is not here. Representative DeRoy, is that how it's? DeVoid.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh.
Yes.
Representative Thacker. Yes. Representative Miles.
Yes.
Representative Prisa. Yes. Representative Burrows. Yes. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan. Yes. Representative Tarasa.
Yes.
Representative Salvi. Yes. Representative Butler is not here. The chair.
Yes. Okay, motion is carried. Now the motion is ought to pass.
15.
Okay, the motion now is ought to pass as amended. Is the question clear?
Do we need one, right? Do we do a new sheet?
Well, it's up to you whether you have plenty of sheets.
Okay. Motion is on to pass with amendment.
Okay, is the question clear?
Representative Patuchek,
Yes.
Representative Osborne is not here. Representative DeVoy,
Yes.
Representative Post says yes. Representative Purcelli. Yes. Representative Walsh. Representative Walsh.
Yes.
Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa.
Yes.
Representative Burrows.
No.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan.
Yes.
Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes.
13 to 2.
Okay. Moving on to the next one. Okay, you're all set then?
If you want to do the next one, I can go.
Yeah, well, yeah, you're all set with the interim study, right? So we can, yeah, okay. All right, so we'll go back to the beginning now, 10:15.
That one on consent or regular? We got two, so we can.
Leave it on the regular calendar. It's fine. Okay, 10. No, we're not going to bother with it. Yeah, she's okay with the interim study. Okay. So I need somebody to make the motion on not weed. Okay, Prisa, perfect. Representative Prisa moves interim study, seconded by, we're now back to the sheet.
So that was Prisa?
Yep.
My notes had ITL. And who was the second?
No, oh, yes.
The last vote we did in subcommittee was 8-1 ITL.
Oh, it was.
That's what I had on my notes.
Okay. Everybody want to do that? Okay, ITL.
ITL
I guess my notes were wrong.
on 10:15.
On 10:15. Okay, sorry. Thank you for correcting us. Okay, any discussion on inexpedient to legislate on 10:15? Seeing none, the clerk will call the roll.
Representative Patuchek,
Yes.
Representative Osborne is not here. Representative DeVoy,
Yes.
the clerk says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa.
Yes.
Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan.
Yes.
Representative Tarasa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here, and the chair.
Yes. Zip, all those in favor of putting on the consent calendar, please say aye.
Aye.
Opposed? Okay. Okay. No, I was going to leave it on the regular calendar.
It's going on regular.
Okay, HB 1023, establishing a accessory commercial units by right. Right, and that is, okay, I got that right. And Priscelli? Did you write the blurb already? No, we haven't assigned it yet. I know, but just. Okay. Represent,
I will second.
okay. Well, I said it, who wants to get their name in the permanent record,
Everyone reads that.
Okay. All right, Representative Burrows, seconded by Representative Baselli, moves inexpedient to legislate. Is the question clear? All those, the clerk will call the roll, sorry.
Who's authoring this? Procuri or
Burrows? Burrows.
Okay.
Okay. Representative Patuchek,
Yes.
Representative Osborne is not here, Representative DeVoy,
Yes.
Representative Post says yes, Representative Priscelli,
Yes.
Representative Walsh. Representative Thaxton,
Yes.
Representative Miles. Representative Prisa. Representative Burrows.
Yes.
Representative Herbert is not here, Representative McAleer.
Here, I mean, yes.
Representative Spear. Yes. Representative Sullivan. Representative Tarasa.
Yes.
Representative Salvi. Yes. Representative Butler is not here, and the chair.
Yes.
Okay,
15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay, 1041, relative to permitting motor vehicle manufacturers to operate dealerships in market areas also served by franchise dealers. Who would like to make this motion? All right, Representative Salvi. ITL. Yeah, seconded by Representative Patusek.
Salvi?
Yep. All right.
And this is IT.
Any discussion on the motion? Seeing none, the clerk will call the roll for inexpedient to legislate.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoy.
Yes.
Representative Post is here. Representative Priscelli. Yes. Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles. Yes. Representative Prisa.
Yes.
Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan. Yes. Representative Tarasa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here. And the chair?
Yes. Okay. Vote 15 to zip. All those in favor on the placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. We're on to 1056, establishing a commission to study the impacts of reinsurance of the cost and availability of property insurance in New Hampshire. Representative Spear, seconded by Representative Patusek, moves interim study. Is there any discussion on the motion?
Who was the second?
Patusek. Oh my God. How did that happen?
Oops.
Don't people know what my day job is? I think I had the ringer. Oh, I see. It's silenced. That's weird. Okay. Okay. Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Excuse me. Representative DeVoy.
Yes.
Representative Post says yes. Representative Priscelli. Yes. Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles. Yes. Representative Prisa. Yes. Representative Burrows. Yes. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan. Representative Tarasa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here. And the chair?
Yes. 15 is it? Carry 15 to zip. All those in favor of placing on the consent calendar, please say aye. No opposed. Okay, next up, HB 1073, clarifying when the Secretary of State shall complete the Registry of New Hampshire Decentralized Autonomous Organizations. Representative Ammon's going to write the blurb, but I will make the motion.
You're making the motion?
Yep,
And the blurb?
will be made by Ammon, but just,
Ammon.
yeah. Okay, I move ought to pass. Any discussion on the motion of ought to pass for 1073? Seeing none, the clerk will call the roll.
Representative Petrucci?
Yes.
Representative DeVoy?
Yes.
Representative Preston, yes. Representative Priscelli?
Yes.
Representative Walsh? Yes. Representative Thaxton?
Yes.
Representative Miles? Yes. Representative Pressa?
Yes.
Representative Burrows?
Yes.
Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Yes. Representative Sullivan? Representative Tarasa?
Yes.
Representative Salvi?
Yes.
Representative Butler is not here. And the chair.
Yes. Okay, the motion carries 15 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay, HB 1124. I will make the motion. Seconded by Representative Petusek, ought to pass. Any discussion on the motion of relative to the right to compute? Clerk will call the roll for ought to pass.
Representative Petrucci?
Yes.
Representative Osborne is not here. Representative DeVoy?
Yes.
Representative Post says yes. Representative Priscelli? Yes. Representative Walsh? Yes. Representative Thaxton?
Yes.
Representative Miles? Yes. Representative Priesta?
Yes.
Representative Burrows?
Yes.
Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Yes. Representative Sullivan?
Yes.
Representative Tarasa?
Yes.
Representative Salvi?
Yes.
Representative Butler is not here. And the chair?
Yes. Fifteen zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Yep. Okay. If you would like to adopt amendment, so you're talking about 1146, 46. Okay, Representative Sullivan has an amendment for 1146. That was- Okay, you're recognized to speak to your motion?
Yeah, so this amendment took a lot of the feedback from our discussion last week.
Oh, no,
And
57.
we created I created an amendment that would require only hardware that doesn't require outside connections to be not tied to subscriptions. So for example, if you have a sensor or something that works, if your car were to be in airplane mode, then, you know, if you're in a dead zone area and you don't require those things, that should still work because it's already installed in your car. So that's what this amendment does. It does not prohibit apps in the subscriptions that like apps to unlock your car from the other side of the country, that sort of stuff you still would have to pay for. So that's what this does. It narrows it down versus kind of covering everything, which the original bill did.
Any discussion on the amendment?
The motion.
The motion is ought to pass on the amendment. So I am adamantly opposed to this amendment because I've just found out that Toyota cars or Toyota Volvo would absolutely stop being sold here in the state of New Hampshire because they do have this feature in which the fob is a throw in, the automatic start the engine is part of that you have to buy that software that only Volvo sells. So I assume that your intent is that you're going to try to shut that down. And I just don't, the last thing I want to do is get letters from Volvo dealers in New Hampshire.
It's fear mongering.
No, they well, how do they get around it? In other words, if they have, the only
there
way
only one
you
way to
can
get
get
around
this
this?
software is to go online and give them a credit card number and the billing. And there, so that if they were to say, okay, well, because New Hampshire passed this law, we're not going to bill it. Well, you can have the regular key. It would just basically, the feature, that Volvo feature would know if the idea is that you're disconnecting that Volvo feature, that cannot be bought in New Hampshire. You cannot be able to start your car.
And
in
I
New
just want to
Hampshire.
reiterate that if we're talking about starting something with a software that say is on an app or something, then it's going to go through cell phone service because most cars now are connected to a cellular network. That service is not prohibited by this amendment. So this example is not actually accurate.
The example we absolutely saw was that on the Toyota is if you don't buy that software, then that fob cannot start the car.
Yes, and what I'm saying is this would prohibit banning a software subscription, or sorry, this would ban things that don't need software. So that fob doesn't need software. It's just a radio
Correct.
frequency.
So therefore, if we pass this,
So they might.
they would
and they're
have to
moving-
disconnect that fob from that operator. That right now that
So then
fob
that's a-
only works
that is a-
because you bought that
That is a
software.
choice they can make. And as you mentioned before, the free market works in many ways, and it might work just fine because they don't want to piss off their customers. We don't know how it worked out. I feel like this sounds a little bit like fear mongering. That's how I'm interpreting this. I think that if you believe in the free market, which you have been claiming is your whole motivation to be against this, then it also works in that way where they'll say, you know what, this isn't worth alienating all the dealerships and all the customers in our state. So it can cut both ways, Mr. Chair.
No, what I'm saying the free market is that if you don't agree with that policy, if you don't want to pay that $10 a month to Toyota, then don't buy a Toyota.
I love going in circles on this, but free markets also depend on well-defined property rights. And what you're saying is that property rights are not as well-defined now. And that and people are paying for equipment on their car. All this says is if the equipment is on the car and it doesn't need software connected to a server somewhere, then it should operate because it's built into the cost of that car. Like my analogy, if you bought a house that has 3 bedrooms and 2 bathrooms, and somebody said, you can buy this house, but in order to have access to the second bathroom, you need to pay $500 a month. That would be absurd. People would roll their eyes at that. That's the equivalent analogy. I'm not saying we shouldn't be paying for things that require ongoing connections and outside costs to the manufacturer. I'm saying things that are already in there and they're built into the cost of the car. And that's what this amendment did, based on feedback from this committee 2 weeks ago. I took that feedback and I worked with good faith to try to address the concerns that were raised.
Fair enough. We have a difference of opinion. Okay, so the motion is ought to pass on amendment number 0957. Yeah, I lost my piece. Yeah, 0957.
Oh, I'm sorry.
Okay, the clerk will call the roll.
Representative Patuchek.
No.
Oh, no. Okay. Representative DeVoid?
No.
Representative Post says yes. Representative Porcelli?
Yes.
Representative Walsh?
The amendment. We're just
Yes.
voting amendment.
Representative Thaxton?
Yes.
Representative Miles?
no.
I'm sorry.
was a
No,
no.
okay. Representative Miles? Representative Prisa? No. Did too fast. Representative Burrows? Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Is not
She
here.
left.
Not here.
Okay. Representative Sullivan? Yes. Representative Tarasa?
Yes.
Representative Salvi?
Yes.
Representative Butler is not here. And the chair?
No.
No. 1, 2, 3, 4, 5. On the nose.
What's the count?
That is, you weren't here, so this is 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 to 5.
Okay, the motion passes, the vote is 9-5. Representative Sullivan, seconded by Representative Walsh, moves ought to pass as amended.
I thought we were voting yes.
I,
Okay. Are we not to pass?
we are ought to pass as amended.
Yeah, ought to pass as amendment is what I would push. Thank you.
Who's moving it? Sullivan?
Sullivan,
And so this is on 957. H. And who it was seconded by? Lily. And so we're just going to use that?
now we're voting on this. I urge everyone to vote no on the pending motion.
So
Vote yes.
on here?
I'm not voting because I'm a freaking chicken heart.
No, you can go vote no. You can just vote no.
No, I can't.
So are we doing another one here? Are we doing this?
Yeah, yeah.
Follow my vote.
So we're doing ought to pass with the amendment. Amendment is 0957. And it was moved by, again, Walsh,
Okay.
Sullivan Walsh.
Yeah, yes, correct.
Okay.
Okay. All right.
Oh, wait a moment.
All right.
The bill up here, so
The motion is ought to pass as amended. Is the question clear? The clerk will call the roll.
Okay. Representative Patuchek.
No.
Representative Osborne is not here. Representative Devoid.
No.
Representative Post says no. Representative Purcelli.
No.
Representative Walsh. Yes. Representative Thaxton.
No.
Representative Miles. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
No.
Representative Spear. Representative Sullivan. Representative Tarasa.
No.
Representative Salvi.
Yes.
Yes. Representative Butler is not here, and the chair,
No.
no. 1, 2, 3, 8, 9, 10, 11, 12, 12, 3 to 15,
What was the vote?
3 to 12.
12 to 3?
12 to 3.
Yeah, that's the nays.
Okay.
Do you have to decide if that's going on the floor?
I would assume we will have this on the regular calendar.
This is OTPA,
I can't imagine you not wanting to
and this is.
get up and explain your version of the free market. Keep using that house scenario. That's a good story. Okay. All right.
We have 12.
Okay. So now we need to vote. We need to have a positive motion. All right. So I will move interim study.
Which one is that?
Same bill. We're not there yet.
Oh, I'm sorry.
We haven't got a positive vote yet. That's a lot of nays there.
Okay.
Okay. So Representative Hunt, seconded by Representative Spear, moves interim study.
So this is.
Any
for-
discussion on the motion of interim study?
I-
All I can say is if you vote for this and we do it all, then we won't have to have a floor fight.
Oh, Mr. Chair, I'm sorry about that. There'll be a floor fight.
Okay. All right.
We use this as the bill?
I mean, I am batting 1,000 for floor speeches, so it's time for me to be humbled.
That's right. After all, you did kill the marijuana bill.
Rightly so. By
It
4
made
votes, so
Representative Walsh very happy, too.
by 4 votes, so I think it,
4 votes.
my speech maybe worked. We'll see how good I am this
Right.
week at orating.
So we
Okay.
just do OT.
All right, so this motion is for interim study,
Yeah.
okay? And
What
it's
do we-
Representative,
What bill are we doing?
we're doing the same bill. We
Oh.
haven't, haven't gone any, till 11:46.
In the wrong place. 11:46. Okay. All right.
Okay,
All right.
is the question clear? Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Post says yes. Representative Priscelli.
Yes.
Representative Walsh.
No.
Representative Representative Thaxton. Representative Miles. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
No.
Representative Spear.
Yes.
Representative Sullivan.
No.
Representative Tarasa.
Yes.
Representative Salvi.
No.
Representative Butler is not here. Representative Hunt.
Yes.
Okay. 1, 2, 3, 4. 11. 11 to 4.
Okay. Motion carries 11-4, and I would assume there would be a minority report tonight, tomorrow, tomorrow morning, the worst case. 11-4. Okay. Got through that one. All right. HB 1207, relative to certain laws applicable to state chartered banks, credit unions, trust companies, and other consumer credit unions, entities subject to the authority of the banking department.
Was that not recommended by the banking committee, if I recall?
No, what happened was that the banking committee that was more than willing to accept the amendment, but it was clear that there was some concern by the Bankers Association, and at this point, they said they waved off and said, go forward with the bill, and that they're very positive that their issues will get properly resolved. So,
Thank you.
now you're leaving.
I don't think anything else is needed for me. My vote's not going to be close, right? So I have to go to work.
Okay. All right. So, Representative Hunt, seconded by Representative Burrows, moves to pass on HB, on the amendment 0922H.
0922H.
Yep.
Okay. And
So-
you're doing it ought to pass?
Yeah, to pass. Is the question clear? The clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Post says yes. Representative Priscelli.
Yes.
Representative Walsh. Representative Thaxton?
Yes.
Representative Miles? Representative Prisa?
Yes.
Representative Burrows? Yes. Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Yes. Representative Tarasa?
Yes.
Representative Salvi?
Yes.
Representative Butler is not here, and the chair
Yes.
is a yes.
Okay. Representative Hunt, seconded by Representative Burrows, moves ought to pass as amended.
Ought to pass.
Jared.
As amended?
Put it on the bill.
Jared. Okay.
We're doing another
Okay,
one?
are you ready? Everybody, okay, the motion now is ought to pass as amended. Is the question clear? The clerk will call the roll.
Representative Patuchik?
Yes.
Representative Devoid?
Yes.
Representative Post says yes. Representative Purcelli?
Yes.
Representative Walsh?
Yes.
Representative Thaxton?
Yes.
Representative Miles?
Yes.
Representative Prisa? Representative Burrows?
Yes.
Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Representative Sullivan is not here. Representative Tarasa?
Yes.
Representative Salvi? Representative Butler is not here, and the chair?
Yes.
12, 13, 14 to zip.
Okay, motion passes. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay. Next up, House Bill 1262. Well,
Oh.
yeah, right, yeah, we're gonna
Stay on this one?
we're gonna jump,
We're doing 85?
we're gonna keep them in chronological order, so we don't screw up again.
That does help.
Okay, 1, 2, 3, 1, 2, 3. Keep a couple for myself. So, Representative Purcelli, I know you care a lot about propane. Do you want to make the motion?
I will make a motion of ought to pass on the amendment.
There you go. Seconded by Representative Burrows.
And it is the motion.
Ought to pass as amended.
As-
On the amendment,
We didn't do the
number, member
979.
0979. We're adopting it now. Ought to pass on the amendment.
979. Okay. And this one was
So,
TP.
in general, this is in generally agreement that this was worked out between the propane industry and the Attorney General's office. I would say it's not totally perfect. There's still some loose ends, but this is puts us way ahead in front for in trying to address this clearly a consumer protection problem that we've kicked this can one too many times. So. Is the question clear? Clerk will call the roll.
Representative Patuchik.
Yes.
Representative Posts, Representative Devoid.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh.
Yes.
Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Yes. Representative Butler is not here. And the chair?
Yes. Okay, motion now is ought to pass as amended. Any discussion on the motion?
And this is as amended. We do another one?
Yep.
This is OTPA.
Right, Representative Purcelli, second by Representative Burrows,
Move OTPA.
to pass as amended.
As amended.
Okay, clerk will call the roll.
Alrighty. Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Poe says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer. Thank
Yes.
you. Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here. Representative, Representative Chair.
Yes.
Representative.
Okay, motion carries.
14.
14 zip. All those in favor of placing on the consent calendar, please say aye. Those opposed, so moved unanimously. Okay, next up, HB 1285. So I've been handed an amendment that turns this bill into a chapter study committee.
This is it.
And after further thought, that given that I think this bill, this concept, as much as worthy as it sounds, is going nowhere, and so I originally, as I wrote on our chart, that we should just interim study it because we'll study within the committee, but the sponsor really would like to have a bunch of other people come together and tell them why it can't happen. And so, how well has this been distributed? This
Is that
chapter-
85?
chapter, everybody has this chapter. So
Is that
this
1285?
amendment is 1009. Then it says mums and spears on top. I will say, this is kill bait on the Senate side. You do understand that. Whereas if we interim study it, we would at least worked on it. Okay.
So this is what we're looking at 85? Right?
Yes. That's
Spear
it.
gonna move that?
Yes.
What's
So
the motion?
Representative Spear, second by Representative Patusek, moves ought to pass on the amendment.
On the amendment to pass. Okay. Excuse me. Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton. Representative Miles.
No.
Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here. And the chair.
Yes.
13 to 1.
Okay. Now the motion is ought to pass as amended.
Okay, TPA, and then we do this here. And this is Spear. Check, okay.
Okay. The question clear? Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
No.
Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes. Okay, motion carries 13 to 1. Are you okay putting this on the consent calendar? Representative Miles? You're not okay with, you want to leave it on the regular calendar? Okay.
That's 1009 each.
Are you going to do a minority report? What's that? If you have to. Well, I mean, the answer is yes. You want to do a minority report. Okay. Okay. All right, next up, 1339, prohibiting the discrimination against cash buyers in business transactions. Who would like to do this one? Don't all speak at once. Okay, I will make the motion.
And who seconded?
And Representative Burrows will second my motion. Keep her in her seat.
Okay. And it's not to pass?
ITL,
ITL.
yeah,
Okay.
cash. Big businesses have to take cash. You might want crypto. Okay. All right. 1339, the motion is inexpedient to legislate. Is the question clear? The clerk will call the roll.
Representative Patuchek. Yes. Representative Osborne is not here. Representative DeVoyd.
Yes.
Representative Poe says yes. Representative Purcelli.
Yes.
Representative Walsh. Yes. Representative Thaxton. Yes. Representative Miles. Yes. Representative Prisa. Yes. Representative Burrows. Yes. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Yes. Representative Butler is not here, and the chair.
Yes.
14 to 0.
Okay, 14 zip. All those in favor of placing on the consent calendar, please say aye. Aye. Those opposed? So moved unanimously. Okay, HB 1353, relative to discounted motor vehicle insurance premiums for volunteers, safe.
1353. We had
Oh,
1347.
1347, you're right. Look at that. I looking at my own handwriting, I can't even see it. All right, 1347 is interim study. Who would like to make the motion?
And this is
Okay.
interim study. And then who was it? Okay, are you?
Okay,
is it
that's right.
Spear?
Yes, she already
Who's
wrote,
second?
already wrote the report on this
Who's second?
one. Me.
And it is interim study.
Okay. Yeah, the sponsor asked us to interim study this bill. So this is moved by Spear, seconded by Hunt. Okay. Is the motion clear? The clerk will call the roll.
Representative Patuchek? Yes. Representative Osborne is not here. Representative DeVoyd?
Yes.
Representative Poe says yes. Representative Purcelli?
Yes.
Representative Walsh? Yes. Representative Thaxton?
Yes.
Representative Miles?
Yes.
Representative Prisa? Yes. Representative Burrows?
He's out of the
Oh,
room.
sorry. Okay. Representative Herbert is not here. Representative McAleer?
Yes.
Representative Spear? Yes. Representative Sullivan is not here. Representative Tarasa?
Yes.
Representative Salvi? Yes. Representative Butler is not here, and the chair?
Yes.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 7, 8, 9, 10, 11, 12, 13. Do their maths.
13. Yep.
13.
Okay. So that is, make sure I get this right. This is, okay. 13 zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay. Next up is HB 1353, relative discount motor vehicle insurance premiums for voluntary safety inspections. Anybody want to do this one? Okay, I'll do it.
What are you doing, ITL?
Yeah.
I'll second.
Excuse me.
Oh, you want to make the motion?
I'll make a motion.
You want to write the blurb?
ITL.
Yeah. Okay. Great.
Do
Perfect.
you want to write something about this?
If you need me to write it for you, I'll write it for you. Okay. Representative McAleer, second by Representative Hunt. Moves in expedient to legislate in 1353. Any discussion on the motion? Seeing none, the clerk will call the roll.
Representative Patuchek,
Yes. Sorry.
Representative DeVoid,
Yes.
Representative Post says yes. Representative Purcelli,
Yes.
Representative Walsh, Representative Thaxton,
Yes.
Representative Miles,
Yes.
Representative Prisa, Representative Burrows, Representative Herbert is not here. Representative McAleer,
Yes.
Representative Spear, Representative Sullivan is not here. Representative Tarasa,
Yes.
Representative Salvi, Representative Butler is not here, and the chair.
Yes.
14 to 0.
14 to zip. All those in favor of placing on the consent calendar, please say aye. Those opposed, so moved unanimously. Okay, HB 1406, prohibiting health carriers from using artificial intelligence to change the clinical judgment of a provider. And we have an amendment. Amendment 1406. All right, so just regard my notes. This was going to be ought to pass an amendment. And Representative Spear, seconded by Representative Petuzek, moves ought to pass on the amendment.
986H.
986.
And that's ought to pass.
Yep. Okay. Okay. Sorry. Are you going to make the motion? Thank you. Okay. So we'll take up, right now it's ought to pass on the amendment. Any discussion on the motion? Seeing none, the clerk will call the roll.
Representative Patuchek,
Yes.
Representative Osborne is not here. Representative DeVoid,
Yes.
Representative Post says yes. Representative Purcelli,
Yes.
Representative Walsh, Representative Thaxton,
Yes.
Representative Miles,
Yes.
Representative Prisa, Representative Burrows, Representative Herbert is not here. Representative McAleer,
Yes.
Representative Spear, Representative Sullivan is not here. Representative Tarasa,
Yes.
Representative Salvi, Representative Butler is not here, and the chair.
Yes.
12, 13, 14 to zip.
Okay.
On calendar.
All right. Now the motion is ought to pass as amended. That would be made by Representative Spears, seconded by Representative Petrusek.
Okey-doke. And it is 14:04. Okey-doke.
Okay. Clerk will call the roll.
Representative Patuchek,
Yes.
Representative Osborne is not here. Representative DeVoid,
Yes.
Representative Post says yes. Representative Purcelli,
Yes.
Representative Walsh, Representative Thaxton,
Yes.
Representative Miles,
Yes.
Representative Prisa,
Yes.
Representative Burrows, Representative Herbert is not here. Representative McAleer,
Yes.
Representative Sullivan, excuse me, Representative Spear.
Yes.
Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Bobby. Representative Butler is not here, and the chair.
Yes.
1314 to zip.
Okay, all those in favor, did I do to pass as amended? No.
Yeah.
Yes, we did. That was it. Okay. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay. 1486, prohibiting insurance companies from considering the driving record of household members not covered by the motor vehicle insurance policy when establishing policy premiums. Who would like to, yes, okay, Representative McAleer. Seconded by Representative Petusic, moves in expedient to legislate on House Bill 1486.
I didn't get the first one. Did
Meckler.
that moved? You?
McAleer.
Oh, Meckler, I'm sorry. Okay.
Who's doing this one?
McAleer.
This is IT.
I guess I need to speak louder. Okay. All right. The motion is ITL. The question clear, the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoid.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh.
Yes.
Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear.
Yes.
Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here. And the chair.
Yes.
Okey-doke.
Okay, motion carries. All those in favor of placing the bill on the consent calendar, please say aye. Those opposed, so moved unanimously. Okay, 1491, relative to pooled risk management programs. I will move to pass, seconded by Representative Burrows.
And it's up to pass. All right.
The motion is clear. Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoid.
Yes.
Representative Post is here. Yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes.
Zip. 1314 to zip.
14
Consent.
zip. All those in favor of placing 1491 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. HB 1502, governing special bank and credit union deposits. I think I'm on this bill. So I think I'll have to make the motion. Okay.
Okay, you're first.
Yeah.
Who's on second?
Burrows.
And it is
Okay. To pass.
Alrighty.
Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoid.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Pressa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here. And the chair.
Yes. So you want to take up your bill? Okay.
Okay, what are we taking up? And this was 14.
All those in favor of placing 1502 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay, so we're gonna jump ahead to the end. HB 1813. Right one?
13, yep.
I move interim study for 1813.
And I'll second it.
Motion?
Is interim study.
Natural study.
Any discussion on the motion? Seeing none? The clerk would call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli. Yes. Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles.
Yes.
Representative Prisa. Representative Burrows. Yes. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Yes. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here, and the chair.
Yes.
15 to 0.
Okay, all those in favor of placing 1813 on the consent calendar, please say aye.
Aye.
Those opposed? Removed unanimously. Okay, we're on the home stretch here. 1504, prohibiting retailers from engaging in price gouging on certain necessary products and services. Who wants to do this one? Really? Thank you, Nita. Okay, Representative Burrows, second by Representative Patusek. Moves ITL. Okay. Is the motion clear? The clerk will call the roll on any expedient to legislate.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post is here. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi. Rep Butler is not here. And the chair. Are you for yes?
Yes.
14 to zip. 14 to zip. On consent.
What's the
14 to zip.
14 zip? Okay. So I thought we did 15. We haven't done 1550? Yeah, I just don't, I didn't have my notes on it. I thought so. I don't know why I didn't.
No, 1582 has to be done.
No, 15, I just, what happened, what was the
1582.
results of 1554? Yeah, 1554. It was
13 to 2, regular
It
calendar.
was 15 to 2,
That was your one that we did first.
13 to 2. Right. Okay, and you're writing the blurb on that one, right? Yes. Okay, 15 for 13 to 2. Okay. Regular calendar. Okay. All right. Okay, now, 15A2, prohibiting the use of credit information, underwriting and rating per personal automobile and a homeowner's insurance policy, and prohibiting certain surveillance practices by insurers. I didn't remember that part. Okay. Anybody want to make the motion?
Make motion to ITL.
Okay, thank you. He's on a roll.
Okay.
As long as you write it up.
Seconded by you. So it's Spear.
Okay, so Representative McAleer and second by Representative Patusek moves inexpedient to legislate.
Okay.
1582, yeah. No, this is credit scoring. And those of us with good credit ratings, we like the discount we get. Okay. Is the question clear? We're dropping like flies here. Okay. Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles.
Not here.
Representative Prisa. Representative Burrows. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes.
7, 8, 12, 13.
13 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Aye, okay. Those opposed? All right. 1630. Now that amendment got passed out somewhat. I don't know how many people got. If not, they're probably stacked up over there. This is nitrous oxide.
This is also IPA.
No,
No, it's OTPA.
you just
Out.
don't. No, no. 16?
Nitric oxide.
Yeah, yeah.
we have
We're not at
something else on it?
1650 yet. You're at 1630.
0867.
It's an amendment?
Yes.
867.
0867.
I didn't have it.
It was passed around at some point, but there might be extras down there.
I have it. Yeah.
Okay.
Oh, I'm sorry. It's the guy, Stretch Armstrong.
Are you? But I'll send it to you to edit.
Okay. So 0867. Okay. So the motion is ought to pass on the amendment. Is the question clear?
Oh, who,
The number is 0867.
is this McLear as well?
Oh yeah, who is making this motion?
Can-
Okay, Representative Burrows. Second by Representative Patusek. Representative Walsh would have done that.
So this is the motion.
It's not
is
just like marijuana.
OTP.
It's too close. Okay, so the question clear?
Yes.
Ought to pass. Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles. Here. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarasa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes. Okay.
11, 12, 13 to zip.
All right. The motion now is ought to pass as amended.
Okay.
Representative Burrows, second by Representative Patusek. Clerk will call the roll. Okay.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli. Yes. Representative Walsh. Yes. Representative Thaxton.
Yes.
Representative Miles is not here. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear.
Yes.
Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes.
12, 13, 0.
Okay, now the motion is ought to pass as amended.
Didn't we do this one?
Who did- that ought to pass?
Yeah,
Okay,
we
yeah, we
did
did.
it. We did
Okay,
it.
great. There we go.
13 to zip.
Okay. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay, next up is 1650, Age App Design Code. That's the one that Representative McAleer wants to kill.
1650
1650.
motion.
Yeah.
Is it out to pass?
Okay, yeah, this is on the, right.
This is ITL.
This is ITL.
Mr. McAleer.
And this is Batuchek?
Yes.
Okey-doke. No, I was
Yeah, no,
asking.
same thing, yes.
Okay.
Clerk's calling the roll. Is this the one you wrote?
Motion is ITL.
Well, if you did, then just, send it to him. That's fine. No, okay, well, okay, fine.
All right, what are we doing?
Spear immaculate, okay. Who knows? Okay. Double kill.
What's the, all right,
Okay.
1650. Let's just see who wrote the best one.
Okay, all right, the motion is, Representative
ITL?
McAleer, Petuzak moves, ITL on 1650. The question clear, the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoid.
Yes.
The clerk says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles is not here. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi. Representative Butler is not here, and the chair.
Yes.
To zip
13 to zip.
on that calendar.
And all those in favor of placing on the consent calendar, please say aye. So, opposed, so moved. Okay. So that was 1650. Now we have 1658. Relative to parental consent and age verification for digital application platforms. I know Keith wants to write this, so I will put my name. I'll make the motion.
I make a motion.
This is the one that was just going after Apple and Google. for- Okay, all right, Representative Spear.
So Spears first.
Spear and then Hunt second.
Is it out to pass?
ITL. Didn't you keep your cheat sheet with you? No, you don't even have it. Okay. Motion is inexpedient to legislate. Is the question clear?
Yeah.
Clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative DeVoid.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles is not here. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi. Representative Butler is not here. Representative Hunt.
Yes. Okay, all those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed? So moved. Okay. HB 1744, relative oversight and reporting requirements for health insurance carriers regarding mental health coverages. Anybody? Anybody? Okay, I'll do it.
Who's
I
second?
I'm moderating candidates night tonight.
Ooh.
Yes. This is town offices. Okay,
It's
so
an
the
OTL.
the motion is inexpedient to legislate on 1744.
Who was the second?
And Representative Burrows. Okay, is the question clear? Clerk will call the roll.
Representative Patusek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh.
Yes.
Representative Thaxton.
Yes.
Representative Miles is not here. Representative Prisa. Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here, and the chair.
Yes.
So we are 13 to zip.
13 to zip. All those in favor of placing on the consent calendar, please say aye. Those opposed, so moved unanimously. And last but not least, House Bill 1765, enabling wine and beverage manufacturers to offer tastings of and sell products of certain New Hampshire wine and beverage manufacturers. Is the Liquor Commission even still here? Okay. I move ought to pass. Oh, it has, okay, yeah, that's right. I did have an amendment.
What's the amendment?
Get an amendment number?
0473. Is it not to pass
Ought to pass on the amendment,
on the amendment? Moved by,
okay?
just moved
By me,
Hunt and
Burrows.
Burrows. Okay. And this says.
Okay, clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yes.
Representative Miles is not here. Representative Prisa. Representative Burrows. Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi. Representative Butler is not here. Representative Hunt.
Yes.
Okay, 13 to zip. Consent?
Done.
Okay,
We have to
motion now is ought to pass as amended. And the clerk will call the roll.
Representative Patuchek.
Yes.
Representative Osborne is not here. Representative Devoyd.
Yes.
Representative Post says yes. Representative Purcelli.
Yes.
Representative Walsh. Representative Thaxton.
Yep.
Representative Miles is not here. Representative Pressa.
Yes.
Representative Burrows.
Yes.
Representative Herbert is not here. Representative McAleer.
Yes.
Representative Spear. Representative Sullivan is not here. Representative Tarassa.
Yes.
Representative Salvi.
Yes.
Representative Butler is not here. Representative Hunt.
Yes.
Okay.
Okay, now the motion is ought to pass as amended.
That
Oh.
is, that was the
Oh,
second.
that was the second one, okay.
And Burrows.
We did them all.
0473H.
Do I want to take pictures of it? Yeah.
4, 7.
Yeah.
Are we done?
I'd
I
say,
had to add them in the bottom. That's how many were running out.
we are done.
Not coming tomorrow.
It's the first
One,
time ever.
one left, one
What's
left.
that? Oh, you do that many? No tomorrow.
Tomorrow.
There's always a tomorrow.
Okay. Sex session is adjourned.
2, 6. So what did we do with 554? What did we do there?
1554.
That was Julie's. We just,
It's not as far as I was thinking. I know Orlando's.
That's 3 hours.
Many committee staff.
You have more?
Hey, Sean, the one thing a little, doubled, I'm gonna edit it.
Are we good?
No worries. If you want to transmit it as it is.
Oh, that'll be Thursday.
We'll be able to.
That'll be
The
Thursday.
individual votes,
In 2 days.
they'll come here. No worries, no worries. Sounds good. Very interesting. Yeah. I have not.
Tomorrow we're not coming, right?
Nope.
Just want to make sure. I don't want any surprise email.
Have a good one.
Yeah, you too.
See you on Thursday.
It's 9 o'clock.
So, Rick, how'd you like that?